right, James. Welcome back to the office.
Thank you so much.
Looks like we're just doing your yearly head to toe today, correct?
Yes, that is correct.
Perfect. Okay, so as usual, I have a couple questions just to confirm your demographical information, and then we can get started with the exam.
Okay.
Okay?
Yep.
All right, so can you confirm the spelling of your last name for me?
Sure. Monroe.
Perfect. And obviously your first name is James.
Yep.
And can you confirm your date of birth for me, please?
Sure. January 17th, 1984.
Perfect. And I see that you moved recently.
Yes.
Can you confirm that new address for me, please?
Yep. 2552 Robertson Lane.
Got it. Okay, and is your pharmacy still the same?
Yes.
Okay. Still the CVS on Jefferson.
Yep. CVS is good.
Perfect. Emergency contact information is still the same?
Yes.
Okay, and any new problems happening with your health? Anything different? Any new symptoms?
No, I don't think so. Everything's been fairly the same.
Not experiencing like any new pain or headaches? No recent injuries?
No.
No surgeries in the last year since I've seen you? Nothing?
Nope.
Okay. Perfect. So it looks like we're going to have a pretty basic exam today. Okay, and family health history is still the same. Nothing's updated as far as heart attacks in your family. Nobody's recent onset diabetes or anything like that.
Nothing like that, no.
Perfect. Okay. Okay, so basically what we're going to do is just like a regular head to toe exam. I'm going to check your eyes and your hearing. I don't think we need to do like a smell or a taste test today, given that you have nothing new going on with your health.
Okay.
I will check your reflexes and your sensation and your overall strength and your extremities and that kind of thing, okay?
All right, sounds good.
Perfect. So let me go ahead and log out of here. Okay. I will put this away and I'll move over and we can get started.
Okay.
Thank you.
Sure.
All right, James, let's go ahead and move on to your physical examination.
All right.
So you said you weren't experiencing any new pain, correct? You're feeling pretty good today?
Feeling pretty good, yes.
So on your pain scale, would you say like a 0 out of 10?
A 0.5.
Okay. Okay. Let's go ahead and just start with examination of your pupils.
Okay.
So I'm just going to have you look right at me, and I'm just going to have a look in your eyes. And no issues with your glasses recently?
No.
You feel like in the last year your prescription has pretty much stayed the same?
For the most part, I am due for my my eval though.
Okay, just checking for that direct and consensual response. So are you planning on making an appointment with your optometrist?
Yes, I am.
Okay. I'm just going to do a little bit of a swinging light test. So just again, focus on my nose. Perfect. I'm getting equal and bilateral pupil response. Okay. So this time I'm going to have you look at my light here. And then look at my finger here. Again, look at my light. Down at my finger. And up at my light. Perfect. And now I want you to follow the light, but keep your head straight, okay?
All right.
Good. A little faster. Any double vision with any of this?
No.
No, like floaters, and no discomfort with eye movement?
No.
Okay, perfect. So this time, I want you to look off to the side. Okay, can you look up for me? Perfect. Just the same thing. This time we're going to look the other way. and look up. Okay, no issues with that.
Okay.
Good. So let's go ahead and have a look at your nostrils here. I'm not seeing any abnormalities in your ears. Can you tilt your head back for me? Perfect, okay. I'm going to include one side, and I want you to just breathe in with the other side. Good. Good. Didn't feel any occlusion or anything with that?
No, I didn't.
Okay. Patency of the nares is normal. Just having a look at the outside of your mouth. Can I have you open your mouth for me? And say, ah. And stick your tongue out. All the way out. There you go. Can you move it to the left for me? All the way to the right. And then on the inside of your mouth, move it over to the left. Good job. Okay. And then I'm going to do a couple palpations.
Okay.
So I just want to have a feel of your jaw. You open for me and close. Open, close. One more. Close. Good. No pain as I feel around here.
No, no pain.
Shifting up to your temples. Good. I'm going to be moving your shirt a little if that's okay. Having a feel for your clavicle. Feeling for any exposed lymph nodes. So far everything feels okay. You haven't been sick recently, right?
No, I haven't.
No pain here.
No.
Have you shrug your shoulders for me? Okay. Okay. So I'm going to kind of come around the side. And if I could just have you turn your head that way, I just want to have a look. Just have a brief look at your ears. No pain or discomfort here, right?
No, no pain.
Back of the hair looks normal. Okay. Same thing, I'll have you look the other way. And same thing here, no pain or discomfort.
No, no pain.
Okay. If you could tilt your head just slightly down for me. Look at your hair. Not seeing any signs of flaking or dandruff. Just feeling for any lumps or bumps. Okay, everything seems to be okay there.
Okay, good.
So, of course, first, I just want to take a quick measurement of your head. I don't guess your head would have changed in the last year, but you never know. 26, which is still within average. And then, there you go. 20. Okay. Thank you. All right, James, next thing we're going to do is have a look at your heart and lungs.
Okay.
Okay, so I'm going to come over on this side. I want you to just breathe normally for me. Good, okay. So I'm going to kind of reach around the back here. Take a deep breath in for me. And again. One more time. Perfect. Deep breath. Good. And one more. Good. Okay. Heart and lungs sound healthy. Nothing there.
Good.
All right, so why don't we move on to a little bit of sensation testing.
Okay.
Very basic sensation test today. I don't see why we would need to go into depth with this. I just want to make sure, for the most part, everything is still hanging out at normal for you. So if I can have you stretch your hands out for me. Does this feel soft?
Yes.
And this feels sharp?
Yes.
And you can tell the difference between that and that?
Yes.
Okay. So I'll have you relax your arms. You're going to close your eyes for me. First thing I want you to do is just say yes if you feel it, okay?
Yes. 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 Yes.
Perfect. Okay, so this time I want you to say yes if it feels the same on both sides. If it doesn't feel the same, like here and here, let me know if it feels differently, okay?
Yes. 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 Yes.
Same everywhere?
Yes, everywhere.
So now I'm going to switch to something a little different. You're either going to feel sharp or soft, and I
Okay.
just want you to tell me what you feel, okay?
Okay. Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. 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 Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft.
Good. Okay, no discrepancies with that one. And next for your sensation, I want to test something that I would consider pretty dull. So you're going to feel different points of pressure. You might feel it very, very lightly, or you might feel it a little deeper. Can you tell the difference there?
I think so, yes.
Okay. So let's say this is 1 and this is 2.
Okay.
Can you tell the difference?
Yes.
Okay, so I want you to say 1 or 2.
Okay. 1, 2, 1, 2, 1, 1, 2, 1, 2, 1, 2, 1, 2, 2, 2, 1, 2, 2, 1, 1, 2, 2, 2, 1, 1, 2.
Good. Okay, so no issues with that. And just a couple more things here for sensation. This one is pretty self-explanatory. It's going to be sharp all the way through, okay? So I just want you to tell me if it feels the same on either side.
Sure. Yes, it feels the same. 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 Yes.
Good, okay. So the last thing for sensation is, are you able to tell that this is cold?
Yes, I am.
Okay, so this one's pretty simple. I want you to just tell me if this gets any warmer as we go down here, okay?
Okay.
Cold.
Same. 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 Same.
Okay, perfect. Don't see any issues with your sensation. Everything is intact there, okay?
Yes.
So let's go ahead and move on to a couple of reflexes. And the first one I want to test is actually in your jaw.
Okay.
So I'm going to have you hang your jaw just kind of loose.
Okay.
Any discomfort with that?
No.
Okay. And we'll do some sensation testing in your arm.
Okay.
So I'm going to take the weight of your arm and I want you to just relax it kind of cradled in my arm, okay?
Okay.
Perfect. Same thing here, just relax your arm. Good. Okay. So relax your arm. Okay. And I'm going to check your pulses while I have you, so just kind of breathe normally. Okay, pulses within normal range and they are equal bilaterally, which is good. Okay, so I'm going to have you keep your eyes closed for me. And I want you to tell me if you feel metal or a brush, okay?
Okay. Metal. Brush. Brush. Metal.
Now open your eyes. I'm going to touch your hand. I want you to keep looking at my face.
Okay.
Try not to blink.
Okay.
Good, okay. Okay, so no issues with that. And let's go ahead and move on to a very, very quick test of your hearing.
Okay.
Are you able to hear this? Okay. So I'm going to put it up to your ear. I want you to tell me when you can hear it, okay?
I hear it. I hear it. I hear it. I hear it.
Okay, now tell me when you stop hearing it.
Now. Now.
Okay, and now I want you to tell me when you stop hearing it and when you can hear it again.
Okay, it stopped?
You hear it?
Yes.
Okay. Do that again.
Stopped?
You hear it now?
Yes.
Perfect. No issues with your hearing. I'll do just one more test. I'm
Okay.
going to just make a couple sounds with my gloves. I want you to tell me what side you hear it on, okay?
Sure.
So close your eyes for me.
Left side. Right side. Left side. Left side. Right side. Right side. Both sides. Both sides. Left side. Right side. Both sides. Left side.
Good, good. No issues with your hearing. So let's go ahead and move on. I'm going to do a test of the strength in your arms, and then we'll move to your legs, okay? You can hold your hands up like this for me. So kind of elbows at your waist. There you go. Pull in and push out. Good. Now if you can have your wrist wrist down. There you go. Try to push up. Good. And kind of open your hands. I'm going to try to spread your fingers here, and I want you to not really let me.
Okay.
And then if you could spread them and don't let me close them. Okay, and just turn. And then I'm going to try to move your thumb out, and I want you to not let me. So your thumb, I'm going to try to move it out. Good, okay. So your arms seem okay. And same thing, we're going to test your shoulders. So we'll do one at a time, up. And then your head, I want you to turn and don't let me push it, okay? So turn. And down. And up. Good. Any discomfort with that?
No.
Okay. So we're going to move things over a little bit. I'm going to have you lay down. I'm going to just feel around your abdomen a little bit and then test the strength in your legs.
Okay.
Okay. All right, James. So let's go ahead and get started. I'm going to do a palpation of your abdomen. Is that okay?
Sure.
So I'm just going to have you kind of rest your arms down.
Okay.
And I want you to let me know, sorry, if this causes you any discomfort, okay?
Okay.
Feeling for any lumps, masses. Feeling for your intestines. Any swelling. So I'm just going to have a quick listen of your bowels. Okay, so bowel sounds are normal and active. Very good. So I'm going to have you rest your hands kind of on your stomach now. And just a quick palpation of your hips and your pelvis. Any discomfort here?
No.
No pain? Just feeling for any signs of abnormality or discomfort. dislocation, but I think we're okay there. Moving down your legs. Okay, just gonna have a quick feel of your knees. No pain here?
No.
Okay. Just gonna feel your feet. Not feeling anything. Not feeling anything abnormal here. Just gonna feel your heel. Okay. Good, okay. Okay, and you can feel me touching your legs equally, right?
Yes, I can.
Okay. So the only thing I really want to test as far as sensation down here is your ability to sense cold. So can you tell me if you can feel this?
Yes.
And that feels cold?
A little bit.
Does it feel cold on this side?
A little bit.
Okay. In comparison to, we'll say this, is this colder?
No, it's about the same.
About the same? Same on this side?
Yep, about the same.
Okay, so there might be a little bit of lack of circulation in your lower extremities. I'm going to test your Babinski reflex, so you're going to feel something sharp at the bottom of your foot, and ideally your foot should curl, okay?
Okay.
No, it's ticklish, I'm sorry. Good, okay, I know that's uncomfortable.
Yes.
Okay, and then I just want you to tell me if this is sharp.
Yes.
Sharp here.
Yes.
And would you say this is soft?
Yes.
And soft here.
Yes.
Perfect, okay. I'm going to come back around and I want you to bend this knee. Any discomfort with that?
No.
Okay. So I'm going to help you lift your knee up. We're going to bring it to your chest. Straight, back down. No pain with that?
No.
Same thing on the other side. Okay, straight up to your chest. And back down. No pain or discomfort there.
No.
Perfect, okay. So I'm just going to do a quick percussion here on your knee. Any pain or discomfort here?
No.
Okay. Same thing. Okay. Okay, so just having a feel for your pedal pulse. Okay, and I know you have pants on that are fairly thick, but are you able to feel this?
Yes.
Feel this here, here,
Yep.
here?
Yep.
Does this feel the same all the way down?
Yes, it does. Yep, that side too.
Okay, and then here, here, here. Same?
Yes, same thing.
Okay, well, I'm not seeing anything notable here today, James. I would guess you're probably good to go for this year's physical.
Okay.
If you'd like to come back next year for your regular head to toe, I think we can go ahead and get you scheduled ahead of time.
Okay.
If you think anything is kind of happening throughout the year and you want to come in for an appointment, that's fine. But other than that, I think you're okay.
Okay, good.
Okay, well, it was good to see you today.
Thank you, you
I'll
too.
give you a couple minutes to gather your belongings and kind of get yourself together a little bit, and I hope you have a nice day.
Thank you.
Thank you.
Bye-bye.
All right, James, let's go ahead and get started with your exam.
All right.
Looks like you're in for just a basic HENT today. Decided to have you laying down for this exam. You were complaining of a little bit of back pain, kind of unrelated to your appointment today. So is this a comfortable position for you?
Yes, it is.
Okay, perfect. So I'm just gonna go ahead and get started with kind of a brief overall inspection of your face. Are you experiencing any issues related to your head, eyes, ears, nose, or throat?
No, I'm not.
Just gonna have a look over your face, like I said, looking for any kind of abnormalities, either in the skin or around your neck area. Look for any swelling. Overall skin appears to be healthy. Just gonna look at your eyelids and eyelashes. We're just gonna have a look at your scalp and your hairline. Are there any issues with your scalp? No itchiness or dandruff or anything? Okay, so hair appears to be normal. I'm not seeing any issues with your scalp. Hair follicles look healthy. Hair shaft appears to be intact. There's not any signs of breakage. Skin texture is normal. Maybe some very slight dryness in this area. Can you just have you turn your head either side for me and have a look at your ears? Ears are a little cold, but skin texture is normal. I'm not seeing any sign of discoloration, and doesn't appear to be any excess sebum that's kind of seeped into your outer ear canal, which is good. Just have a look at the back of your ear. Okay, texture and color is normal. Good. Okay. I'll have you turn your head the other way for me. Again, texture is normal. Not seeing any issues with discoloration or any kind of visible abnormalities. Back of the ear looks normal. While your head is like this, I'm gonna have a look at your chest. Just move your shirt a little here. All of that looks normal. Go ahead and turn your head to a neutral position for me. I'm going to have just a basic listen to your temporal arteries here. Check for even blood flow. So let me go ahead on the inside of your shirt. Perfect. Okay. All of that sounds normal. So why don't we go ahead and move into some questions here. I'm just going to test for any pain or abnormalities in your jaw. Okay, so I'm going to do a little bit of tapping like this, and I want you to just tell me if any of that causes you any discomfort. Issues with that, and this time you can just kind of hang out. I'm just gonna listen for any abnormal sounds as I kind of oscillate here. Sometimes if there are more hollow sounds, you can tell me that there might be some abnormalities. So far, everything looks and feels normal. Can you hang your jaw open for me? A little more. Very good. Okay. And no pain or discomfort with any of that, correct?
No.
Perfect. Okay. So what I'm going to do next as far as testing your head is I want you to turn your face either side. We're going to be testing both sides, so you can start whichever way you prefer. I'm going to be pushing against your face. I want you to push against me in the opposite direction and try not to let me control your head, okay? So go ahead and start. Good. Other side. And down. And back. And open your jaw. Don't let me close it. Close it. Don't let me open it. So I want you to tightly close your eyes. Don't let me open. And then I want you to open. Try not to let me close. Good. Okay. Doesn't appear to be any issues with that. I am just going to place my hands under your head, and I'm going to manipulate your head. I want you to just allow me to do so, okay? Okay, can you tilt your head back for me? Good. Any pain or discomfort with that?
No.
Okay, you can return your head to a position that's comfortable for you. So the next thing I want to do is test your sensation in your face. So I have a couple different things here. Can you tell that this is soft?
Yes.
So I want you to say yes when you feel it in various areas on your face, okay?
Okay.
So eyes closed.
Yes. 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 Yes.
Perfect. And can you tell that this is sharp?
Yes, I can.
So same thing. I want you to say yes when you feel it. It'll either be like this or like this. Either way, say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay. So this time I'm going to alternate between sharp or soft. And I want you to say either sharp or soft, okay?
Yes. Sharp. Soft. Sharp. Soft. Sharp. Soft. 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 Sharp. Soft. Soft. Sharp. 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 Soft.
So this time I want you to tell me if this feels equal bilaterally. So you're going to tell me if it feels equal on both sides, okay?
Yes. 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 One side. There you go.
Good job. And one last one. Does this feel equal all the way down?
Yes.
Perfect. Okay. So sensation appears to be within normal limits. I do want to just test one last thing. I have a little wheel here and it's pretty sharp. It looks more alarming than it actually is. I'm just going to be moving this on various parts of your face, mainly in one direction. I want you to tell me if the sensation changes as we move along, okay? So feel the same all the way down.
Yes, it does. A little sharper there.
Sharper towards your eye.
Yes.
Okay, that's totally normal. Same there.
Same. 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 Same.
Here.
Yes.
Here and here is the same.
Yes.
Same, same,
Same.
same. Feel normal here, no pain or discomfort in your hair.
Oh.
And on the jawline, feel the same on both sides.
Yes.
And how about here, here?
Yes.
How about here and here?
Yes.
Same here.
Same.
Perfect, okay. So definitely not suspecting you're having any issues with your sensation, okay? So if you lift your head for me, I'm going to do just a quick measurement of the size of your head. 26.5 inches there. And 24 there. 9, just about 9 inches from chin to forehead. And 13 there. Okay. So all of those measurements are within normal limits for someone of your age and height, which is good. So not suspecting anything really wrong with the health of your face and head overall. Let's go ahead and move on to a bit of an eye test. This is going to be a little different because you are laying down, but trying to accommodate that back pain there. So I want you to just open your eyes for me. I'm going to have a look inside your pupils. I'm just going to be moving your eyelid a little bit. Looking for symmetrical reaction. Can I have you look up towards me? That's great, I apologize. Perfect, okay, so that appears to be normal. Okay, so I want you to just remain looking up at me. I'm just gonna shine this at the bottom. Perfect, so I'm gonna place my finger here and I want you to look at that. Try not to look at the light. And I want you to keep your head still and follow my finger. Any floaters or double vision with any of that?
No.
Okay. So then I want you to keep your line of sight remaining straight. Look at the ceiling. I'm going to move my fingers on either sides of your face. I want you to tell me what number you see me holding up. So this would be 2, 3. We'll kind of go from there, okay?
All right. 2, 3, 1, 4, 2, 2, 5, 1, 2, 3, 4.
Very good, okay. So no double vision or anything with that. Did either of the hands appear blurry or discolored?
No.
Okay, perfect. So I'm not suspecting any abnormalities with your eye health. I do know that you wear glasses, but
Yes.
your prescription is up to date, correct?
Yes.
Perfect, okay. So let's go ahead and move on to testing your nose, and basically I just want to see that you're not having any kind of occlusions on either side. I'm going to test the overall patency of your nares, so I'm going to be occluding one side,
Okay.
and I want you to just breathe in normally for me.
Sure.
Go ahead and breathe in. In here. Any abnormalities with that? Are you feeling kind of a closure on one side? Both sides appear normal to me.
Yes.
Okay. So I'm going to do both sides. I want you to take a breath in through your mouth. Out through your nose. Very good. Okay. So doesn't appear to be any abnormalities with that. Nose is pretty midline. I'm not seeing any signs of a deviated septum or anything there, so. Okay. Let's go ahead and move on to your ears. And first I just want to see if there's any kind of discolored cerumen or earwax in your ears. So I have some regular just cotton buds here. I'm going to be very, very gently inserting this into your ear. Okay, nothing there. And nothing there. Perfect. Okay. So I'm going to do a very brief test of your hearing. The first thing I'm going to do is make a sound on either side. I want you to just first tell me what side you hear it on, okay?
Sure.
So close your eyes for me.
Right side, left side, right side, left side, left side, left side, right side, both sides, left side, right side, right side, right side, left side, left side, right side, both sides, both sides, left side, right side, both sides.
Very good, no issues with that. So the next thing I'm going to do is occlude one side and whisper something on the opposite side. I want you to just repeat after me. It'll be a series of either 3 numbers or 3 words, okay?
Okay.
Apple, orange, lemon,
Apple, orange, lemon,
purple, yellow, green,
purple, yellow, green,
peaches, oranges, apples.
peaches, oranges, apples.
Good job. We're going to do the other side. Doctor, nurse, patient,
Doctor, nurse, patient,
student, teacher, principal,
student, teacher, principal,
chicken, pork, steak.
chicken, pork, steak.
Good job. This time I'm going to do a series of numbers and they're going to be a little bit quieter, okay?
Okay.
21, 32, 57.
21, 32, 57,
18, 23, 54.
18, 23, 54,
There we go. Other side. 18, 32, 53.
18, 32, 53,
17, 5, 6.
17, 5, 6.
Very good, James. No issues with that. The last thing I'm going to do to test your hearing is to make a very slight sound with my tuning fork. So just to start, I want you to tell me if you can hear it. So can you hear that?
Yes.
Perfect. So just say yes if you can hear it, okay?
Yes. 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 Yes.
Good. And now I'm going to be putting it against your ear. You're going to hear it stop, and then I want you to tell me when you hear it again, okay? You hear that?
Yes.
Tell me when it stops.
Okay, stop. I hear it again.
Good. Do that again. You hear it?
Yes.
Tell me when it stops.
Stop. I hear it.
Very good. Okay. So this time I want you to tell me when you stop hearing it. So I'm going to move it further away from your ear. Tell me when you no longer hear it. Can you hear it?
Yes.
Tell me when it stops.
Right now.
Very good. Here.
Yes.
Tell me when it stops.
Stops.
Good job. Okay. No issues with your hearing. That appears to be totally normal. Alright, James, so the last thing I want to do for your HEENT today is just check your throat. So I want you to just open and close for me. Good, okay. And I'm just going to feel around your trachea, also feeling your thyroid. Is there any discomfort here?
No.
You don't ever have any issues with your swallowing, correct?
No, I don't.
Can I have you swallow for me? One more time. Perfect. Okay, so that appears to be totally normal, and I would say that you passed with flying colors today, James. I'm not seeing any abnormalities in your head or with your eyesight. Your prescription is up to date. Like you said, you're seeing your optometrist regularly. Should you see any differences or abnormalities with your vision, I recommend going back to your optometrist.
Okay.
Your hearing was totally normal. Not seeing any reason why we would need to test that further. And your nose seemed healthy. So overall, I would say you're pretty good to go. Clean bill of health from me today. If you'd like, we can schedule your yearly visit up at the receptionist desk. I would like to see you back in a year. That's just kind of standard. We prefer to do annual visits just to keep up with everything that's going on, make sure we're not missing anything. So you can either schedule that now or call in when you're ready, okay?
All right, thank you.
All right, James, thank you so much. Have a good day, and I hope your back gets better.
Hey,
Hi, how's it going?
pretty good. How are you?
I'm doing well. My name is Dr. Perez. It's nice to meet you.
You too?
First name is James, correct?
Yes, it is.
Is it okay if I call you James?
That's fine.
Okay. So it looks like we're doing a comprehensive physical today. Is that correct?
Yes, we are. Full
Okay.
physical.
Full physical. Can I just have you confirm your last name for me?
Sure. Monroe, MONROE,
And your date of birth?
2/25/1985.
Perfect. And is there any specific reason for your visit today?
No, it's been a few years since I've had a physical, so I
Okay.
just want to get it once over.
Okay, so you're a little overdue. Just
Yes.
making sure everything's going okay.
Yep.
Okay, well, we have quite a bit to go over. The comprehensive physical is a little bit lengthy, so I'll
Okay.
start with some preliminary things. I'm going to take your vital signs. I do want to do a COVID swab if that's okay with you, just to make sure we are negative today. Because it's been so long since you've had one, I do also want to get a set of labs on you. Make
Okay.
sure like your A1C and your cholesterol and all that is doing okay.
All right.
So we'll get that sent off to the lab. After that, I do want to go ahead and have you give me a urine sample so we
Okay.
can test for anything else. Make sure everything's doing okay. We might as well while you're here.
Sure.
I'll have you change into the hospital gown and then we'll kind of get started from there, okay?
All right.
Perfect. So let me set this down. Just gonna get a pair of gloves on.
Okay.
How are you feeling just kind of in general right now?
Good.
Feel okay? No
No
specific
ailments.
pain or anything?
No.
Perfect. Okay, well, let's go ahead and get started with your vital signs then. I am going to start by placing this on your wrist. If I could have you turn your arm for me. cross that over your stomach and hold it just like that. This device is going to test your oxygen levels as well as your pulse. I'll just place that on your finger. Just relax your hand for me. And lastly, I'll be checking your temperature. If I can have you lift up your tongue. There we go. And then I'll take just a second. We can go ahead and take this off. Blood pressure today is a little elevated. I have 151/87. Your heart rate is 81, which is fine. This should be done. Yeah, 98.4, which is totally normal. And your oxygen levels are at 100%, which is great.
Okay.
Do you have a history of high blood pressure?
No, I don't.
No? Okay. Interesting. So definitely something that I just want to know. 151/87. So that systolic number is a little higher than I would like. Typically, I'd want you to be under 135 for your age.
Okay.
When I do your labs, I will do a heart panel just so we can make sure that everything with that is okay.
Sure.
Okay. So let's go ahead and move on. I am going to do a COVID swab. Okay. No COVID symptoms today, correct?
No.
Okay. So I'm sure you know this is a little uncomfortable. I won't insert it fully, but we are going to have to do both nares today, okay?
All right.
Okay, we're all done. Not too bad, I hope.
No, it's okay.
I will dispose of that and perfect, okay. So I'll let that sit. It takes just a few minutes, and while we're waiting, I'll go ahead and listen to your heart. So I just want you to breathe normally for me, okay? Perfect, and I am going to go around the back and listen to your lungs. Okay. Okay, so every time I touch you from this point on, I want you to take a deep breath in and out. Good. Good. And one more. Okay, perfect. Now you'll feel me place 2 hands on your back. Each time I touch you with both hands, I want you to say 99 out loud.
99, 99, 99, 99, 99, 99.
Okay, perfect. Heart and lungs both sound completely normal. I didn't hear any sort of arrhythmia, no palpitations happening, everything sounded totally normal. Lungs are both clear, no signs of pneumonia. So that is all good to go. Perfect, okay. All right, James, so what I'd like you to do, excuse me while I reach over your cat, is I need a urine sample from you.
Okay.
Don't have to fill the cup up all the way. If you could get at least to the 30 or 40 cc mark, that would be great. I'll have you just place it back in the biohazard bag. There's a little window in the restroom. You can just open it and leave it in the window, and the lab tech will take that for you, okay?
Okay.
If you could also change into the gown for me.
Okay.
We're gonna start with it open in the back.
Okay.
Okay, all right, thank you so much. I'll see you in just a minute.
Thank you.
All right, James, is it okay if I come in?
Yes, it is.
Perfect, thank you. And your sample is with the lab. I spoke with the tech. She's getting it processed, so that should take just a couple minutes. I will have those results for you before you leave. So is it okay if I get your labs done at this time?
Sure.
Perfect. So I'm just gonna have a seat. And pardon me while I get a little closer to you.
That's fine.
Is this arm okay to do the sample?
Yes, it is.
Okay. So I'll have you kind of invert your arm. Just gonna move that out of the way. Perfect. All right. And generally, do you have trouble getting your blood taken, or does it usually go okay?
It goes okay.
No nausea, vomiting, dizziness, anything like that?
No.
And looks like you have decent veins, so I shouldn't have trouble getting a sample today. Perfect, okay. So I'm gonna go ahead. I do have quite a bit to get from you today. I just want to do a full panel to make sure everything's going okay, and then I did add on the cardiac labs just because your blood pressure was high. Okay.
Okay.
Okay. So I'm gonna go ahead and place my tourniquet. If I could have you just gently lift your arm. It's gonna be a little tight. I do apologize. Is that painful?
No.
Okay. Okay. This is just ChloraPrep. It's basically alcohol. It's gonna clean the area. It does feel a little cold though. Okay. Give that just a second to dry. Okay, if you're ready, I'll go ahead and insert my needle.
I'm ready.
1, 2, 3. Okay. Starting off with our cardiac panel. Perfect. Perfect. Okay, moving on to our type and screen. And these last 3 are just testing for various ailments, STDs, STIs, testing your A1C, cholesterol, etc. Last one. Okay, so we are good to go. I'm going to remove the tourniquet. Getting ready to pull the needle out. And just have a piece of tape here. And we'll keep this on for the duration of your visit. Okay, let me just dispose of this in our sharps container. I am going to quickly hand these to the nurse so she can take them to the lab, and then we should have these results back soon, okay?
All right.
So I will be right back.
Okay.
All right, James, I'm back. Let's go ahead and get started on our preliminary questions. So I do have quite a few to go over with you.
Okay.
As I was dropping that off, I spoke with the lab. Your COVID swab was negative, so good news. Your urine did come back, not positive or anything significant, so you're good to go there, okay? Perfect, okay. So let's go ahead and get started with some preliminary questions. What is your current pain level?
Current pain level? 1.
1? Okay. Are you having any abnormal symptoms anywhere?
No.
No.
I'm not.
Okay. So these questions are going to go from head to toe, essentially.
Okay.
Do you ever experience any headaches or migraines?
Headaches every now and then.
Occasional headaches?
Yes.
And are these brought on by anything specific?
I believe they're just seasonal allergies.
Okay, so it's kind of sinus
Sinus
pressure.
pressure, yeah.
Is this mostly kind of fall spring?
Spring, for sure.
Spring.
Yes.
Okay, so you've been having some trouble with that recently, I would guess.
Yes, I have.
Okay. No migraines.
No.
Okay, do you take anything for it?
Claritin every now and then. Only when it's severe.
Okay. And when is the last time you would say you had a dose of Claritin?
Not since last allergy season. So,
okay, so it's
none,
been quite a while.
Yeah, none this year at all.
Perfect, okay. Let's go ahead and move down to your eyes. Do you have any specific eye problems? I see that you are wearing glasses.
Yep, just regular needing glasses and that's all.
Okay, no, do you wear contacts?
No, I don't.
Okay. When was your last eye exam?
It's been about 2 years.
Okay, so you are due for an eye exam.
Definitely do.
Do you have a regular optometrist?
I did, but my insurance changed, so now I need to select a new one.
Okay, do you need a referral to an
Sure.
optometrist? Okay,
That'd
I
be
can
great.
provide you with that, sure.
Okay.
So we can do that on your way out, absolutely. Ideally, we'd like to have you see an optometrist once a year, I'm
Yes.
sure you, yeah, okay. Do you feel like your current prescription is adequate for you?
It's probably time for a stronger dose, honestly.
You think so?
Yeah.
Okay. Having a little trouble?
Sometimes at night.
Okay. I do notice that maybe the scratch resistance has worn off a little bit on your glasses. You've got some scratches. Okay.
Definitely time for an
So
upgrade.
we will be doing kind of a mini eye exam today just to
Okay.
make sure everything is going well overall.
Okay.
But obviously for a more comprehensive exam, you will need to see the optometrist, okay?
Sure.
All right, just gonna take a little note here. Behind on eye exam. Make sure we get you in for that. Moving down to your nose, you already said that you have seasonal allergies.
Yes.
Okay. With that, do you have like runny nose, dry nose, sneezing, coughing?
I would say runny nose and some sneezing.
Runny nose and sneezing. And you did say that you take Claritin if it's too severe. Any issues with dryness?
No.
Yeah. Do you snore?
Yes.
Okay. And is that all the time or just when you're experiencing allergies?
I think all the time.
All the time? Is that something that bothers you or you it's just kind of your normal?
It doesn't bother me.
Okay. Okay. Moving down to your mouth. Are you currently having any issues with teeth pain or sensitivity?
No, I'm not.
Perfect. How frequently do you visit the dentist, would you say?
Every 15 months.
Okay, so roughly once a year?
Yes.
Do you have a dentist that you see regularly?
Yes, I do.
Okay. So ideally, I would like to see you going to the dentist at least every 6 months, once a year at minimum.
Okay.
Okay. I know that seems kind of frequent, but cavities can tend to pop up more frequently than you would think.
Okay.
Okay. And then I will be doing a brief oral exam. How frequently do you brush your teeth?
Twice a day.
Perfect. And flossing?
Every day, every other day.
Okay. So we need to be a little more strict with the flossing. It's very important that you floss at least once a day, preferably at night.
Okay.
Okay. Perfect. Moving on to your ears. Do you have any problems with hearing loss, ear pain, abnormal discharge, excessive earwax?
No.
None of the above. Do you wear earbuds, either in ear or over the ear?
Over the ear for the most part, every now and then.
Okay. Are you ever exposed to loud sounds or music?
Yes, I am.
Is that like recreational or?
Recreational.
Okay.
And it's not too often.
Okay. But haven't noticed any kind of progressive hearing loss over the years? You feel like your hearing is fine?
Yes.
Okay. Perfect. Moving down to your chest and heart area, I did have a listen. I didn't notice any abnormalities. Do you ever feel any chest pain, tightness, aches, palpitations, any kind of arrhythmia where you feel like your heart is beating abnormally?
No.
Perfect. Healthy heart. Okay. And moving on to your upper extremities, your limbs, do you notice any joint pain, shoulders, elbows, wrists, pain, fingers?
Depends. Certain activities, if I haven't done them in a while, I might have a little soreness.
Okay.
Just in the joints, maybe. Elbows.
Okay.
Shoulders.
And that's just kind of with an increase in mobility.
And physical.
Okay.
Yeah.
Do you notice any lack of flexibility?
No.
You did say you have some kind of mild joint pain.
Yeah.
Do you ever take anything for it?
Maybe just an Aleve or an Advil.
Okay. Aleve will definitely be your best bet for joint pain because it is going to help bring down the inflammation while simultaneously helping with the pain. So Aleve is definitely a go-to for joint pain.
All right.
And as far as your abdomen, stomach, do you have any issues with your stomach, with eating?
No.
Any discomfort?
Nope.
Kind of acid reflux, nausea, anything like that?
No. It's been a while since I've had acid reflux. So
Okay.
no.
Normal bowel movements?
Yes.
How frequently are you having bowel movements on a daily basis?
Once or twice a day.
Once or twice?
Mm-hmm.
Perfect. And those are normal formed?
Yes.
Okay. Perfect. All right, just a couple more questions. Moving on to your legs, lower extremities. Do you have any trouble walking?
No.
Feet pain, joint pain, knees, ankles?
I have flat feet, so
Flat feet?
every now and then I might have a little bit of pain in the middle where my non-arches.
Okay.
Just depending on which shoes I wear or how much walking I'm doing.
Supportive they are.
Yeah.
Okay. On a regular day-to-day basis, what kind of shoes would you say you typically wear? Like a sneaker, a loafer, a dress shoe?
A sneaker.
Sneaker.
Either
Okay.
basketball or running sneaker.
Okay. So fairly supportive. Perfect. And I didn't notice any gait disturbances as you were walking in and out. Do you notice any kind of lack of balance or coordination, issues with dizziness or tripping? Are you clumsy typically?
No, I'm not.
Pretty well balanced overall. Okay, so moving on to a couple questions about your sexual health. Are you currently sexually active?
Yes, I am.
How many partners do you have at the moment?
One partner.
And is that casual or long term?
Long term.
Okay. Do you practice safe sex, whether it's birth control, condoms?
Yes.
Okay. Do you have a history of STD or STIs?
No, I don't.
And we did test your urine. You are negative for all STD history at this time.
Okay.
Okay, and just a couple more questions. Are you currently engaging in both oral and penile penetration?
Yes.
Okay, and have you ever had a prostate exam?
No, I have not.
You haven't, okay. So I know this is probably the last thing you want to hear, but you are due for a prostate exam. It is time. Your first exam was due at 40, so I do recommend getting that done. You would have to do like an outpatient appointment. I can give you a referral for that.
Thank you so much.
It's not emergent, but it is highly recommended that you get one done. After you get your initial, you shouldn't have to get it done for another 5 years. Okay. So when you go to the receptionist for your optometrist appointment, I will let her know and she can schedule that for you, okay?
All right.
Okay. It's good to be proactive. Okay. All right, James. Well, the good news is we are done with the preliminary questions, unless you have anything that you'd like to ask me before we get started with the exam.
I don't think so.
Okay. So we have quite a few things that we're going to go over. We are starting again from head to toe. So we'll start with some head palpations. We'll kind of move down.
Okay.
There'll be some moving around. I'll have you turn around at some point so I can view your back. And then for the end portion of the exam, you will be laying down. Okay?
All right.
Perfect. So let me just set this aside. I'm going to remove my stethoscope and we will get started.
Sounds good.
Okay, so let's go ahead and get started with the physical portion of the exam. I'm going to come behind you. I want to have a look at your scalp, okay?
All right.
Okay, so just going to start with a kind of visual inspection. Okay, so just starting with a brief physical inspection. Scalp looks healthy. I'm going to be feeling around a little bit. I want you to tell me if any of this is painful or uncomfortable. Not feeling any lumps or bumps. Not noticing any visible dandruff or flaking. Scalp doesn't appear overly oily or dry. How frequently do you wash your hair?
Every few days, every other day.
Okay, good. So you're not washing it every day, which is ideal. Not noticing any male pattern baldness. Hair is full and even throughout. Texture is equal and normal. Just having a look at the back of your neck. You have a couple little moles, but they don't appear abnormal. This one is raised, but it is round and symmetrical. Okay. While I'm back here, can I have you tilt your head as far back as you can? Any pain or discomfort there?
No.
Okay. Just gonna feel around the sides of your neck. Feeling underneath. I'm gonna have you open and close your jaw. Perfect. And around your collarbone. Can I have you shrug your shoulders? One more time. Perfect. Okay. No issues with that. I'm going to come around the front and do a brief examination of your face.
Okay.
Thank you for removing your glasses.
Sure.
Just having a look at your skin. Not noticing any discoloration or dryness. Texture appears even. No visible active acne. Perfect. Having a look at the neck. Perfect. Just taking a little note. Okay, let's go ahead and move on to an eye exam if that's okay. So just kind of a brief eye exam.
Okay.
Definitely should put your glasses back on. First thing I'm going to have you do is follow my pen light. So I want you to keep your head kind of midline, and you're only going to move your eyes, okay?
All right.
Perfect. Any symptoms of dizziness, blurry vision? Everything
No.
was normal for you
Yes.
there? Great. Okay. So I want you to place this over your eyes just as it is. Can you see out of this side with
Yes,
the
I can.
perforations?
Yes.
Can you tell me how many fingers I'm holding up?
2, 3, 5, 1,
Flip it the other way.
2, 5, 3, 2.
Perfect. Okay. That was testing for glaucoma. All right, so next I'm going to test you for color deficiency.
Okay.
This first one is a control. Can you tell me what number you see here?
Sure. 12.
And what color is the number?
It is orange.
Perfect, okay. And do you see a number here?
Yes, number 8,
Here?
number 5, 29, and 74.
Okay, for the next one, I want you to tell me what color the outside is.
It is red, yellow, orange.
And the number?
Number is green.
And here?
45, and it's a brown, light brown, dark brown.
Perfect. Do you see a number here?
Yes, I do. Number 2.
Do you see a number here?
No, I don't.
Here?
16.
Here?
No.
Do you see anything here?
Yeah, it's like a snake.
Perfect. Can I have you take the non-writing side of that pen and trace that line for me?
Sure.
Very good. Can you trace the number you see here?
Sure, 35.
Very good, okay, good job. Not noticing any issues with color deficiency. And just a brief eye exam, can you read that for me?
Sure. Ishara's test for color deficiency, concise edition, 2017.
And the last 2 words?
Tokyo, Japan.
Very good, okay. So your glasses for now are at least giving you adequate vision.
Yeah.
They may need to be updated slightly, but you are
Right.
able to see.
Yep.
And you wear those when you're driving, correct?
Yes, I do.
Okay. All right, James, so lastly for your eye exam, I want you to hold this device over one of your eyes.
Okay.
You choose.
Okay.
Okay, can you see me with your unoccluded eye?
Yes.
Perfect. So I'm going to be holding my hands up. Can you see both of my hands?
Yes.
I'll be wiggling one side, both sides,
Okay.
switching back and forth. I want you to tell me which side you see wiggling.
Okay.
Keep your line of sight at my nose, okay?
All right. My left side is wiggling. Both sides are wiggling. Right side. Left side.
Perfect. You can switch eyes. Can you see both of my hands?
Yes. All right. Left side. Both sides. Left side. Right side.
Good job.
Left side. And both sides.
Perfect. Okay. No discrepancies there. You did very well with that.
Thank you.
Any blurry vision, double vision with any of those tests?
Yeah.
Perfect. Let's go ahead and move on to your nose. I'm going to start by having a look. If I could have you tilt your head back for me. Looking for any obvious occlusions. Now just gently tilt your nose up. Perfect. Okay. So I'll have you take a breath in for me. And here. Any issues with nasal patency? Are you occluded on one side or the other? Seasonal allergies are doing okay today?
They're done okay. No occlusions.
Okay. I am going to test your sense of smell. I have 3 different things here. And just to confirm, I didn't see that you had any actual allergies.
No.
Okay. So I want you to close your eyes and kind of take a whiff. Don't breathe in too aggressively because these are pretty potent. Can you tell me what that is?
Citrus.
Very good. That is sweet orange.
Okay.
Let's do this one. Go good.
Peppermint.
Very good. And the last one. This one's a little more mild.
It's almost like a spice, but I'm not sure what it is.
Okay, so I'll give you a clue. It's a very common essential oil and it's floral.
I'm not sure.
Okay, that's lavender.
Ah,
Okay, that's okay. That one's a little more difficult. Like I said, it's a little more mild, so some people do have trouble, but you did well with that.
Thank you.
Okay, so let's go ahead and move on to your mouth. I'm just going to start by having you open your mouth for me. Stick your tongue out and say, ah. Very good. Show me your teeth. Big smile. Good. You have beautiful teeth.
Thank
No signs of cavities. Your teeth are very white. Do you whiten your teeth at all?
Don't.
Just naturally white?
Twice a day, brushing.
Perfect. Okay. So I'm going to test for jaw strength.
Okay.
So this is a bite block. I'm going to have you open, bite down. Okay, other side. Bite down. Middle. Good. Any pain or tenderness with that?
No.
Very good. And the last thing I'm going to do is have you open up. Just have a look at your molars. Seeing any cavities there. Very good. Okay. Teeth look great. So everything as far as your oral health looks good. I do want to see you flossing daily.
Yes.
Okay. Okay. So why don't we move on to your ear exam and hearing test. If I could have you turn your head for me. Just having a look at your ear. As I kind of pull and move around, are you experiencing any pain or tenderness here?
No, I'm not.
Nothing here.
Nope.
Turn the other way for me. No pain, discomfort.
No pain.
Okay. Very good. Let's go ahead and move on to a hearing test. So if I could have you close your eyes.
Okay.
I have a tuning fork here. Can you tell me if you can hear this?
Yes, I can.
Tell me when it stops.
Stops.
Okay, so I'm going to place this in the middle of your head.
Okay.
Can you tell me if you hear that equally and bilaterally on both sides?
I think so, yes.
What side do you hear it now?
Left. Right.
Very good. I'm going to hold this up to your left ear. Can you hear this?
Yes, I can.
Tell me when it gets louder.
Louder.
Tell me when it stops.
Stops.
Good. Can you hear this?
Yes.
Tell me when it gets louder.
Louder.
Tell me when it stops.
Stops.
Very good. Okay. All right, so I have a little device here that's going to blow a slight puff of air
Okay.
into your ears.
Okay.
I want you to tell me what side you hear it on, okay?
All right.
So this is testing your directional hearing. You could hear it in the back, the top, the front, either side. Ready?
Yep. Left side. Right side. Right side. Back. Right side back. Front left side.
Good job.
Left side. Top middle. Back.
Very good. Very specific answers. So lastly, for your hearing, I want you to close your eyes again. I'm going to be making a sound on either side with my fingers, and I want you to just say yes when you hear it, okay?
Yes. 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 Yes.
Okay.
Yes.
And I want you to tell me if 1 or 2 sounds closer. So this is 1, and this is 2.
1 was closer.
This is 1, Is this 2?
2 is closer.
Perfect. Absolutely no issues with your hearing. Very good. Moving on to an exam of your neck. I already palpated around a little bit for your lymph nodes, but I want to check a little in the front. If I could have you tilt your head back.
Sure.
Can you swallow? Any pain or discomfort here?
No.
Your palpation of your collarbone. Not feeling any abnormalities here. Lymph nodes are not palpable, which is ideal. Okay. All right, very good, James. Are you doing okay?
Yeah, I'm doing fine.
Okay. So we are about a third of the way through, I would say. Let's go ahead and test for head and neck movements. So if I could have you turn your head to the side, and then all the way to the other side, all the way down, tuck your chin, all the way back, and then if you can do a rotation. Any pain, discomfort there? I didn't hear any clicking.
There was a slight click on the left.
Okay, uncomfortable or just?
No, just stretching.
Adjusting. Okay, very good. All right, so let's go ahead and move on to your facial sensation. You can keep your glasses on. I'm going to be doing a variety of sensation tests here. And the first one is going to be just kind of a light cotton wisp. So if I could have you extend your hand for me. This is what you're going to feel.
All right.
And I want you to just say yes when you feel it. So you'll have your eyes closed.
Yes. 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 Yes.
Did all of that feel equal and bilateral?
Yes, it did.
Perfect. Same thing. This time you're going to feel a wooden poke, okay?
Okay. Yes. 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 Yes.
Okay, very good. And lastly, I have a little bit of a sharper object. You're going to feel this. And this time I want you to tell me if it feels the same on both sides, okay?
Mm-hmm.
So this should feel the same as this.
Yep, same.
Here and here.
Same.
Here and here.
Same.
Here and here.
Same.
Okay. No loss of sensation or tingling with any of that, correct?
No.
All right, James, you are doing really well.
Thank you.
Let's go ahead and move on to test your upper extremities. So I'm going to be testing strength and reflexes in both of your arms.
Okay.
So first I want you to hold your arms up like this. So kind of turn, there you go. Pull in, now push out, very good. Now like this, push down and up, and turn your hands like this. I'm gonna try to separate your fingers, don't let me separate them.
All right.
And now let's do the opposite. So you open your fingers and I'm gonna try to close them, don't let me close them.
Okay.
And now just your thumb. Very good, upper extremities are strong. Okay, so now I want you to hold your hands straight out. Close your eyes. Just keep them out. Testing for balance and coordination. Keep your hands out. Very good, you can open your eyes. I'm gonna go ahead and test your reflexes. So I want you to just relax your arms completely.
Okay.
Good. Very good, okay. No issues or abnormalities there. I'm just gonna check your pulse. Just relax your arms for me, there you go. Pulses are equal, strong. Very good. Okay. All right, James, let's go ahead and move on to upper extremity sensation testing. So similar to what we did on your face, I'm going to test your arms now, okay?
All right.
Okay, so let's start with just a light cotton wisp. So you should feel this.
Okay.
Close your eyes. Say yes when you feel it.
Yes. 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 Yes.
Perfect. And did that feel equal on both sides?
It did.
Okay, something similar. I want you to say yes when you feel it.
Yes. 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 Yes.
And if I could have you pronate your hands for me, so you're going to turn. There you go. This time I'm going to drag this tool down your arm, and I want you to tell me if it feels differently at all as we move down, okay? Feel the same all the way?
Feels the same. Feels the same.
Okay. Same here.
Yes.
Perfect. And lastly, same thing this time. It's going to feel like this, okay?
Okay.
Does that feel the same as this?
Yes.
And this and this?
Yes.
Here and here?
Yes. Yep. Yes. Yes.
Perfect, okay. So upper extremity strength and sensation appears normal. The last thing I'm going to do is draw a number or a letter in either hand, and I want you to tell me what it is. This is testing for your proprioception, okay?
All right. 3. I'm sorry, one more time. I'm not sure. 5.
Very good.
5.
This is a letter.
A. I'm not sure. D.
Yes. Okay. And just because you did get a couple of those incorrect, I want to test one more thing. So I'll have you close your eyes.
Okay.
Can you tell me what this is?
Yeah, it's a pen.
Very good. Keep your eyes closed. And can you tell me what this is?
Yes, it is a tape measure.
Very good. Okay. So no issues with that. You can go ahead and open your eyes. All right, James, so let's go ahead and have you turn around.
Okay.
I'm going to be testing your back. I want to check your spine, do some general palpations. I want to check your kidneys. So I'm just going to have you turn around, okay?
Okay.
All right, thank you. All right, James, are you comfortable the way you are?
Oh, yes.
Okay. So I'm just going to start with a general inspection, have a look at your skin. I do see some discoloration in this area. Looks like it might be due to some excessive dryness. Do you tend to have dry skin?
Yes, I do.
Okay. Just having a look. Just see a couple moles. Just a little bit asymmetrical in shape, but it's not raised to the touch. Couple freckles. Okay. Just feeling around. Let me know if you have any pain or discomfort with this, okay?
Okay.
have some dryness in this area. So I'm going to be palpating around your kidneys. You'll feel some tapping. I want you to tell me if it's painful at all, okay? Tenderness. Any discomfort with that?
No,
okay.
not at all.
I'm going to do the same thing, this time with a smaller hammer and lighter tapping down your spine.
Okay.
Any pain or discomfort with any of that?
No.
Perfect, okay. So I want to test your sensation. Just that light cotton wisp again. Tell me yes if you feel it, okay?
Yes. 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 Yes.
And does this feel different than this?
No, it doesn't.
This doesn't feel any different than this?
Oh, yes. One was a swipe, one was a poke.
Okay. And here, here?
Yes. Yes, 2 pokes and a swipe.
You feel this?
Yes, I can.
You feel this?
Yes.
You feel this?
Yes.
This?
Yes.
This?
Yes. 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 Yes.
This feels
Yes.
the same all the way down.
It does.
Here.
Yes.
Here.
Yes, it does. Yes, it does.
And if we go horizontal.
Same.
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 Any difference here, this drier area?
No.
Feels the same.
Same.
And this should feel fairly cold. Does that feel cold to you?
Yes, it does.
In comparison to this?
Yes.
Cold here.
Yes.
Any loss of sensation as we go down?
No.
It feels the same coldness all the way down.
Yes, it does.
Is this colder?
Yes.
Okay. Colder here,
Yes. Colder here.
colder there
Yep.
for sure. And here.
Colder there.
Okay. We should feel some vibration.
Yes.
Okay, and in comparison to that, this should just feel like pressure.
Mm-hmm.
Okay. So I want you to tell me if you feel vibration or pressure.
Okay. Vibration. Pressure. Vibration. Pressure. Vibration. Pressure.
Very good. Okay. So let me just take down a quick note. All right, James, everything as far as your back and spine appear perfectly normal.
Okay.
The last thing I want to do before I have you lay down is So if you could lean as far forward as you can. Okay, and then I want you to lean back slowly. Testing for any signs of scoliosis, and your spine is perfectly straight. So I will move my instruments out of the way for you.
Okay.
I want you to lay back down. We're going to flip the gown the other way so that it's open in the front and your chest is exposed. Head on this side, feet on the other. Okay?
Yep.
So I'll give you a second as soon as I move these items.
Okay.
All right, James, are you comfortable?
Yes, I am.
Okay, perfect. So I'm going to start off by having a listen to your bowels. So I'm just going to be placing my stethoscope on your stomach. Bowel sounds are active but normal. Did you have a bowel movement today?
Yes, I did.
Okay, perfect. Just having a look at your chest skin overall. Noticing any acute abnormalities. So I do just want to kind of gently palpate around. You let me know if this causes you any discomfort. Any pain here?
No.
I'm going to go a little deeper. Just palpating your spleen, liver, okay, so everything feels relatively normal. I'm going to do a brief sensation exam. Can you tell me if you can feel this?
Yes, I can. Yes. 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 Yes.
Does this feel differently than this?
About the same. Same. Same.
Okay. Can you feel this?
Yes. 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 Yes.
Feels cold,
Mm-hmm.
cold,
Yes.
cold
Cool.
compared to this.
Yes.
No loss of sensation here compared to here.
No.
Okay. Just gonna do a quick percussion there. That sounds normal. Moving on to your lower extremities. Just gonna feel around your pelvis. Any pain or discomfort here?
No.
No pain in your hips.
No pain.
Perfect. And how about your knees?
No, just regular knee soreness.
Regular day-to-day aches and pains.
Yes.
Can I have you bend this leg for me? Just feeling around your joint. So I'll have you lift this leg up. Now bring it towards your chest. Good. Extend straight out. Rise up. Back down. Any pain or discomfort there?
No.
Same thing with this leg. If I can have you bend your knee flat on the bed. There you go. so let's lift up, bring towards your chest, straight out, and we'll go up and back down. Any pain or discomfort with that?
No.
Perfect. Just be testing your reflexes here. Moving down. Is it okay if I raise your pants slightly?
Sure.
Just having a look at your skin. And you did say you have flat feet, which I can see. Do you have any pain or discomfort with your feet today?
No, I don't.
What size shoe do you wear?
16 triple E.
Okay. And you feel like that supports your feet adequately?
Yes, it does.
Can I have you push your feet down like you're pushing the gas pedal and back towards you? Perfect. I'm going to try to separate your toes. I want you to try to clench them together. This side. Good job. Very good. Can you feel this?
Yes. Yes.
Any difference between this side and this side?
No, I don't think so.
I know you have socks on, but can you feel this?
Yes, I can. Yep. Yep. Yep.
And here.
Yes.
Here.
Yes.
Any difference between this side and this side?
No.
Can you feel this?
Yes. 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 And yes.
Perfect. And now I am going to try to induce your Babinski reflex. So you're going to feel a sharp swipe on the bottom of your foot, okay?
All right.
Very good. Very good. I'm sorry. I know
That's
that's
okay.
it's a little uncomfortable, but that was a normal response. All right, James. Well, I will go ahead and come back around the bed. The good news is everything appears totally within normal limits.
Okay.
You passed all facets of the test, so I wasn't seeing anything that I would say is an abnormal response. So I will let you sit up. You can go ahead and get dressed. I will have those referrals at the receptionist office ready for you.
Okay.
Do you want to follow up with those? And if you have any questions, you are welcome to call me, okay?
All right, perfect.
All right, thank you so much.
Thank you.
If there's nothing else, I'd like to see you back within 6 months to a year, okay?
Right, okay.
Okay, have a good day.
You too.
Thank you.
Bye.
All right, Mr. Monroe, are you ready to go ahead and get started with your examination?
Yes, I am.
Okay, well, it's good to see you today.
Thank you.
I apologize for the circumstances. It looks like you had a fall at home.
Yes, I did. A few days ago, I was bringing in groceries from Costco. I thought I was at the top step. There was one more step to go.
Oh, okay.
I kind of tripped. Having a little issues with my right side. I would say my shoulder, my elbow, and also my right knee as well.
Okay. And what symptoms are you having exactly? Is it like pain?
A little bit of pain, some swelling, and some soreness for sure.
Did you happen to hear any kind of popping or clicking when you fell?
No.
Anything that would indicate a dislocation or a break?
No, there was no clicking or popping. I don't think
Okay.
anything's broken or dislocated.
And no extreme pain with mobilizing or with your like disturbance in your gait or anything like that?
No, it's not extreme.
Okay. All right. Well, according to the RN at intake, your vital signs were stable, which is good news. So no issues with that.
Okay.
Is the height and weight on file correct?
Yes, it should be.
Perfect. So just to get started, I have a couple questions. I'm going to be testing your cognitive ability, see if you have any kind of cognitive impairments happening. Okay.
Okay.
You didn't hit your head, correct?
No, I didn't.
Okay. Okay, so if I could have you repeat 3 words for me.
Okay.
Lamp, bed, window.
Lamp, bed, window.
Okay, so these are all items in this room. There is a lamp, you are on a hospital bed, and there is a window in the room.
Yes.
I will be having you repeat these words to me a little bit later on, okay?
Okay.
Can you tell me what today's date is?
Sure. Today is May 19th, 2023.
Perfect. And can you tell me what you had for breakfast this morning?
Yes, I had scrambled eggs, I had potatoes, and I had turkey bacon.
Very good. And what about what you had for dinner last night?
Last night I had mashed potatoes, green beans, and shrimp.
Very good. Okay, and can you tell me what the name of the street you grew up on was called?
Sure, I grew up on Robinson Lane.
Perfect. That was testing your long and short-term memory, which both seem to be intact. Do you have a history of any blacking out periods or seizures?
No, I don't.
What about visual impairments aside from the glasses, like floaters or blurry vision, double vision?
No, just the glasses.
Do you have an astigmatism?
No, yes, I do actually. I do.
Okay. Any lack or loss of mobility or coordination? Have you been clumsier lately? Noticing a lack in flexibility?
No, just this one time.
This is just kind of like a happenstance. It's not something that usually happens. Do you remember the last time you fell prior to this?
Actually moving into this house about 2 years ago. The same thing with the step.
Okay. Gotta be careful with those steps.
Yes.
Okay. All right, well, if it's all right with you, we will go ahead and get started with the exam. The last portion of your cognitive test is going to be having you repeat back those 3 words. Do you remember what they were?
Yes. Lamp, bed, window.
Very good. So I'm definitely not noticing any sort of neurological deficits as far as I can tell, okay?
Okay.
So let's go ahead and get started with the physical portion of the exam. I'm going to be starting with a head exam. I know you said you didn't hit your head, but it's still good for us to check for any sort of bumps or lesions or anything, okay?
All right.
Excuse me while I just clean my hands.
Sure.
Are you in any pain or discomfort at this time?
A little bit. My shoulder. It's a little bit of tightness.
Okay. And have you been taking anything for it?
Just regular Aleve.
Okay, perfect. Aleve is definitely what I would recommend. It's going to help bring down some of that inflammation. I know you said you were experiencing a little bit of swelling.
Yes.
Okay, so I'm just going to have a look at your head and neck areas, and there's no kind of sensitivity or any pain in this area as far as you're aware, correct? Just feeling around for anything that might be notably abnormal. It's not likely that you'll have a head injury. Normally, when you hit your head, you know right away. And since the fall, have you had any headaches?
No, I haven't.
Any pain or discomfort in your ears? Does all of this feel okay?
Yes.
Can I just have you lift your head slightly? Okay, you can go ahead and relax. I'm definitely not noticing any swelling or any bumps or abnormalities in your head, which is good news.
Okay.
Just take note of that. Let's go ahead and move on. While I have you laying down, I'll go ahead and do my initial physical assessment here on the parts of your head.
Okay.
So I'm going to be testing for nasal patency. Basically means I'm testing for any occlusions in your nares, whether or not you're able to normally breathe through both sides.
Okay.
So I'm going to include one side, and I'll have you take a breath in for me. On the other side. Okay, and that all sounds clear to me. Did you notice any obstruction?
No, I didn't.
Okay, perfect. If I could have you just open your mouth for me, I'm just going to have a look inside. Does it appear that you might have chipped any teeth? The teeth look good. Stick your tongue out for me. Okay, mouth and tongue both appear totally normal. Just going to have a look at your ears. Looking for any signs of bleeding of the ears, anything that might indicate an injury to your eardrum, but I think we're okay here. So I'm just going to do a very, very brief hearing test to make sure everything's intact there, okay?
Okay.
Can you tell me if you can hear this?
Yes.
And this?
Yes.
Tell me when it stops.
Stopped. Stopped.
Perfect. Can you hear this?
Yes.
Tell me what side you hear it on.
Right side, left side, right side, right side, left side, both sides, left side, both sides.
Very good. No issues with your hearing. Is it all right if I remove your glasses for just a second?
Yes.
If you hold on to those. I'm just going to have a look at the area around your eyes. No symptoms of sensitivity, any kind of sensitivity to light or anything like that?
No.
Well, if you open your eyes for me, I'm going to be shining a light in your eyes. I'm just checking for pupillary reaction.
Okay.
Direct and consensual response appear to be within normal limits. Okay, so I want you to track for me. Keep your head midline and follow the light with your eyes. Any pain or discomfort with that?
No.
Okay, very good. So now I'm going to be testing your peripheral vision. I want you to keep your head and eyes up at the ceiling. I'll be moving my fingers at the sides of your face. I want you to say yes when you can see my fingers moving, okay?
Yes. 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 Yes.
Very good, no issues with that. Lastly, for your eyes, can I have you hold this over your eye? I'm going to remove the cover on this side. Can you tell me how many fingers I'm holding up here?
I can't see it. 2. 2. Can't see it. 2. 2.
Okay, switch for me.
Okay. 2. Can't see. 3. 2. 2.
Okay. So I'm going to try that again with your glasses. Can I have you put your glasses on for
Sure.
me? Ready?
Yes. 2. 3. 3. 2.
Okay, go ahead and switch.
2. 3. 2.
Okay. So So you did a lot better with your glasses, but there does seem to be a little bit of a discrepancy in your peripheral vision. I would guess that you probably need to have your glasses updated. When is the last time you saw your optometrist?
It's been about 2 years now.
Okay, so I definitely recommend having an appointment with your optometrist so they can have a look at that. And just gonna do a quick test for color deficiency. Do you see any colors here?
Yes, I do.
Can you tell me what they are?
Sure, red, orange, green, light green, dark green.
Very good. And do you see any numbers on this page?
Yes, a 7 and a 45.
Very good. And last one. Do you see any numbers on this page?
Yes, 16, and there's just a design on the right side.
Can I have you follow that for me with your fingers?
Sure.
Very good. No issues at all with color discrepancy, which is perfect. Just take down a couple notes here. Okay, do you have an optometrist that you're able to make an appointment with?
Not at the moment, no.
Okay, is that something that you'd like me to refer you to?
Yes, please.
Perfect, I will go ahead and do that for you. You can pick up that referral at the receptionist desk on your way out. Okay, so lastly for our head and neck examination, I'm going to do a brief sensation test. Make sure you're not having any sort of sensory deficits in your head or neck, okay?
Okay.
So I have a couple different things that I'll test with. Let's start with something very, very soft. Are you able to feel this?
Yes.
Can you tell that that's soft?
Yes.
Okay, so I want you to say yes when you feel it. Go ahead and close your eyes for me.
Yes. 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 Yes.
Perfect. Now, are you able to feel this?
Yes.
Can you tell that that's sharp?
Yes, I can.
I want you to say yes when you feel it.
Yes. 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 Yes.
Very good. I'm testing for pressure sense. Are you able to feel this?
Yes, I am.
And this?
Mhm.
Can you feel that they were slightly different?
Slightly.
Okay, so I'm just testing for pressure sense. Essentially, I want you to be able to tell me whether you can feel it lightly or deeper. You're just going to say yes, regardless of how hard you feel it, okay?
All right. Yes. 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 Yes.
Okay, very good. And lastly, do a very, very brief test for temperature. These are very slight differences, but can you tell that this one is not as cold as this one?
Yes, I can.
Okay, so I want you to say 1 or 2.
Okay.
2 will be the colder, okay?
1, 2. 1, 2.
Good job.
1, 2. 1, 2. 2. 2. 1, 1. 2.
Very good. Good job. That test is a little difficult because it is a very slight difference, but you did very good with that. All right, James, so I am going to go ahead and move over to have a look at your shoulder and elbow, okay? So give me a second while I just get settled.
All right.
All right, James, I'm over on your right side. Is it okay if I just move your shirt a little?
Sure.
Okay. Just gonna have a look at the outside of your arm to see if there's any notable abrasions or anything. It doesn't look like you broke the skin. Did you have any bleeding when you fell?
Just like a scrape.
Okay. Looks like it's healed up, which is good. Do you have any pain here?
Just a little with my shoulder.
Okay.
Yeah, kind of right there, whatever that tendon is.
Right here?
Yeah.
Okay. So do you feel just a little bit of swelling in there for sure? Does it hurt less as I go down?
Yes, it hurts less.
Okay. Inside of the elbow, painful at all?
No, it's not.
How about the outside?
Yes, the outside.
Okay. When you fell, did you hit your elbow? Did you like land on your arm?
I kind of landed on my elbow on my forearm.
Okay. It's a pretty typical injury for falling. Unfortunately, we tend to brace ourselves with our wrists or our elbow when falling. Looks like you might have had a small abrasion here that healed up nicely.
Right.
Okay. So is the pain more here or kind of directly on the bone?
Closer to the bone.
Okay. Any pain in your wrist?
No.
Okay. And how about up kind of near your clavicle? Is all of that okay?
It's a little tight there as
Slight,
well.
just kind of discomfort.
Yes.
Would you say it's more painful here or here?
It might be even.
Okay.
They're equal.
I'm going to press a little more deeply. It might be uncomfortable. I'm just trying to feel for any specific injuries. So I'm suspecting you might have a very minor tear in that rotator cuff.
Okay.
Because I see the swelling kind of following down along your clavicle, down to the muscle that connects here. I'm going to do some extension of your arm. I want you to just kind of give me all of your weight here.
Okay.
And tell me when it becomes more painful, if anywhere.
It actually feels more painful as it's closer to my body.
So more painful
more
here.
Painful there.
Okay. So this is
Yeah.
probably a very uncomfortable
Yes.
one. Okay. Interesting. Okay. And if we bend at the elbow, is that uncomfortable or is it more uncomfortable if you flex out?
It's more uncomfortable bending.
It's more uncomfortable this way.
Yeah, it's not terrible though.
Okay. So it's definitely more painful in the shoulder.
Yeah.
Okay. You do have some slight redness here, and I'm definitely noticing a fair amount of swelling. It's not edematous, it's just definitely swollen to the area. Just doing some temperature testing. It's definitely a little warmer up here. And cooler as we come back. Elbow. Maybe very, very slightly warmer, but the temperature is more even throughout your lower arm, which is great. I'm going to do some sensation testing of your arm.
Okay.
I want to make sure there's not any loss of sensation due to the swelling. So let's start with the same soft kind of cotton wisp that we used on your face. Can you feel this?
Yes, I can.
Okay. So I want you to say yes when you feel it, okay?
Yes. 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 Yes.
Okay. Did any of that feel any less sensitive than other areas?
No, I didn't.
Okay. And then we're going to do the sharp. Can you feel this?
Yes.
Okay. So you might feel this or this. I want you to say yes either way, okay?
Okay. Yes. 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 Yes.
Any loss of sensation with that?
I don't think so.
Okay. And did that cause you any pain or discomfort?
No, not at all.
So let's go ahead and try something a little more obvious. So I have a metal wheel here. This is called a Wartenberg wheel. It's pretty sharp. Can you feel this? Okay. So I want you to just initially say yes if you feel it, and then we'll try something else, okay?
Yes. 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 Yes.
Okay. So now I'm going to bring this down across your arm laterally, and I want you to tell me if it feels any differently as we move down, okay?
Okay. Yes. And it does not feel differently. It feels the same. And there's no difference. No difference. No difference.
This feels the same as this,
Yes, it does.
and this, and this,
Yes, it does.
here and here,
Yes.
and then all this should feel the same.
Yes, it does.
And no difference up near your clavicle or on your chest.
No.
Very good. So I want to test for any signs of neuropathy. So I have a kind of plasticky bristle brush. So I have a kind of plasticky rough bristle brush.
Okay.
And I'm going to be swiping this along your arm. So I'll show you kind of on your face.
All right.
I want you to say yes when you feel it, and if you feel any sort of tingling or burning sensations, let me know, okay?
Okay. Yes, I feel it. Yes, I feel it. Yes, I feel it.
She's gonna jump on top of you, just ignore her.
Yes, I feel it. Yes, I feel it. Yes. 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 Yes, I feel it. Yes, I feel it. Yes, I feel it. Yes. Yes, I feel it. Yes, I feel it. Yes, I feel it.
So any tingling, burning?
No.
Okay, so all of that felt okay.
Mm-hmm.
Very good. So let's go ahead and do testing for temperature. So I have two different globes here. One of them is slightly colder than the other.
Okay.
Can you tell the difference between this and this?
Yes.
So I want you to tell me when you feel 1 or 2, 2 being the colder, okay?
Okay. Colder? 2? Oh no, that's 2. That's colder.
Okay.
1, then 2. 1, then 2. 2, then 1.
Very good.
2, then 1, I believe. 1, then 2. 1, then 2. Hard to tell with that one. 2, then 1.
Very good.
2, then 1. One more time. 1, then 2. 2, then 1.
Very good. Okay. So you did okay with that. I have another object here that is fairly cold.
Okay.
Can you feel this?
Yes, I can.
Okay. So I want you to tell me if this feels any different as I move down your arm.
It may have felt colder at first.
Colder at the beginning?
Yes.
Okay.
Yeah, colder in the beginning. Yep. Yeah, it feels more cold on my shoulder than it does on my elbow.
Okay, so colder up here. So this, compared to this, you would say this is colder?
Absolutely.
Here and here.
Yes.
What about here versus here?
Colder the second on my forearm.
Okay. And here versus here, same or different?
Same.
Here and here, same or different?
Same. About the same.
Okay.
Same.
Can you feel this?
A little bit.
Slight vibration.
Yeah.
You feel it here,
Yes.
here,
Barely.
barely here.
Yeah.
You feel it here?
Not too much. Yes, now I feel it. Yes.
Here. It all feel the same.
Yes, it does.
Okay. And can you feel it here just as much? Or does it feel less over here?
No, it feels more down there.
More down here?
Yeah.
Okay. I'm going to do some gentle percussing around the area here. Just testing for any abnormal reactivity. Is that painful?
No, it's not.
And up on the clavicle. Here.
No pain.
No pain. Okay. Lastly, I just want to test one more thing. Can you tell me if this and this feel any different than this?
They feel about the same. I just think there's a little bit less sensitivity on my elbow.
Less sensitivity, so you maybe feel this slightly more
Yes,
here than here.
that's correct.
So I want you to tell me at what point, starting here, do you start to feel it less?
No.
Okay, here.
Mm-hmm. Yep, no. Yes.
Okay. So I do suspect that you have a fair amount of swelling in your elbow, also in the shoulder area, but it looks like more so here, which is why you're having a little bit of that lack of sensitivity.
Okay.
The swelling essentially is occluding your sensory perceptors from allowing you to feel things as much as you would in the areas where it's not as swollen.
Okay.
So I'm thinking we need to keep you immobilized for a few days. I would like to have you wear a brace. It's just a soft brace. It's nothing super compressing, but it will help keep your arm stabilized while it's healing, okay?
All right.
So I will get that on you when we are finished with the exam. I do want to go ahead and have a look at your knee because it sounded like you were having more trouble with your knee than you are with your shoulder.
Right.
Like you kind of mostly landed on your knee is what I
Right.
was understanding.
Mm-hmm.
Okay. So if I could have you sit up for me, I'm going to have a look at that knee. Go ahead and fix your shirt. Okay. All right, James. So it looked like we definitely have some swelling in your elbow. I have the sling for that, which I'll be putting on you at the end of our appointment today. So let me go ahead and have a look at your knee. And just kind of right off the bat, I do definitely notice some swelling in comparison to the other side.
Okay.
The measurements that I took showed about 1.5 inches difference on this side, which is kind of significant. Is any part of this particularly painful?
Just maybe right in the middle.
Right in the middle?
Yeah.
Okay.
Just a little, yeah.
So definitely noticing some swelling when I push in. Can kind of see that there's a delay there. Okay. When you fell, did you kind of kneel down on your leg?
Yeah,
or?
I did.
Okay. A little bit of joint manipulation here. Is this painful?
It's okay.
So luckily, it's definitely not broken. Nothing is dislocated or fractured. It's likely you've kind of just severely bruised the muscle here, which is why it's so tender.
Okay.
Any pain down here?
That's kind of where it hurts, yeah.
More so here.
Yeah.
Would you say this area hurts more than here? Or about the same?
About the same, but probably not. No, I wouldn't say that.
Okay. So this is the most painful?
Yes.
Let me just... Can I have you extend your leg onto mine?
Sure.
Is that uncomfortable for you?
It's okay now.
Okay. Definitely noticing some swelling here.
Yeah.
Is the back of your knee painful at all?
No, it's not.
None of this is painful or uncomfortable
No.
here? Okay. I'm going to do a little bit of that sensation testing on your leg.
Okay.
Can you feel this?
Yes.
Okay, so say yes when you feel it, eyes closed.
Yes. 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 Yes.
Okay. Did that feel the same up here as down here?
Yeah, it did.
Okay. So now we're going to do the sharp.
Okay.
Yes when you feel it.
Yes. 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 Yes.
And did that feel the same top and bottom?
It did feel the same.
How about if I kind of move this down your leg, tell me if it feels any differently as we move down, okay?
No, that feels the same. Same. Same.
Okay. And here.
Yep.
Okay. Let's do some of that neuropathy testing. So same thing with the brushing motion. Tell me any stinging or burning, okay?
Okay.
Oh, that felt pretty normal.
Yeah, it all feels fine.
Okay. So let's do our sharp sensation here. Are you able to feel this?
Yes.
Okay. Tell me if it feels the same going across.
Yep, it does. Yes. Yes, the same. Yes. Yep.
Okay, so let's go ahead and try something cold. Are you able to tell that this is cold?
Yes, I can.
Okay. Does it feel as cold here
Yes.
as well as here?
A little less cold there.
Here? Here?
Less cold on the second one.
Here? Here?
About the same.
About the same. So here, a little bit less.
Yeah.
Okay. So I bring this down. Does that feel different down here?
Right at my knee, look, my lower knee, it doesn't feel as cold.
Right here?
Yes.
Interesting. Okay. How about from this side?
Yeah, same thing.
Okay. So it looks like we're having a little bit of that loss in sensation from about here to here.
Yeah, that's about right.
Okay. Now I want you to tell me if you feel one globe touching you or two at the same time.
All right.
Okay, so one or two.
Okay. One. One. Two. One. Two. 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 One. Two. One. One. Two. Two. One. Two. Two. One. Two. Two.
Okay. So you're definitely having some loss in this area.
Okay.
Okay, so I'm going to do a little bit of reflex testing here. So just kind of relax your muscle. Try not to hold your leg up. Just completely go flaccid for me. Just a little bit of delayed reaction. The reactivity in your ankle and foot is normal, but there's a slightly delayed reaction here in your knee, likely due to the swelling. So the good news is I don't think there's anything serious going on. I do think you need some ice therapy. Have you been icing your leg?
Off and on.
Okay. So I'd like you to ice it for a total of 1 hour a day in 15 to 20 minute increments, okay? So if you can do 15 to 20 minutes in the morning and then in the afternoon and at night, it would be ideal just to bring down some of the swelling. Stick with the Aleve to help with the pain or inflammation. I don't see why you would need any weight-bearing restrictions. You should be able to walk normally unless you're feeling painful or uncomfortable. Then you can kind of shift your weight to the other leg. I do want you to keep weight off of this arm for 2 days. So I will give you a sling for that. Because you're having the increase in swelling in this area, I do want to wrap this. So it's kind of like a lymphedema wrap. It's essentially going to compress your leg to help redistribute some of the swelling. So it'll compress this area and kind of force the swelling up and down so that it's able to heal more evenly. And then I also have a knee brace that we can try. Okay, cool. So let me go ahead and get your supplies. I'm going to have you just bend your leg here. So I have a flex wrap here for your knee. And this is the sling for your arm. And different things here. This is an instant ice pack. So I can have you re-extend your leg for me. We're just gonna relax here. Is that okay for you?
That's fine.
Okay. This is gonna feel a little tight. I'm gonna wrap it with the ice pack. How long is your drive home?
About 25 minutes.
Okay. So we'll leave this on here till you get home. When you get home, you can unwrap it. It's just gonna start that initial phase to reduce the swelling, and then I want you to wear the knee brace anytime you're out of bed for the next 2 days, as well as the sling, okay? Obviously, you can take it off to take a shower, but then go ahead and put it back on. Okay. Okay, how is that? It should feel tight, but not uncomfortable.
That's good.
this is a flexible knee brace, so it gives you all of the regular mobility, just a little bit of added support. It also provides some of that compression to help with the swelling. Put it on. Obviously you want the hole going right where your knee is. Bring these around, and you want it to be taut but not so tight that you can't bend your leg. Up and under. And then these straps will come around the back. Go ahead and relax your leg. How does that feel?
Feels good.
Does it feel like it's too tight?
No.
Okay, looks great. So I'm going to show you how to use the sling. And essentially this is just forcing you to be immobilized so that you can't move it in an awkward position to keep it in place so that you can heal that tear, okay? So once I place it, it's going to be measured for your injury. So to take your arm out, I don't want you to undo it.
Right.
You just kind of lift your arm up and then untuck. Okay. So go ahead and raise your arm for me. Okay, and I want you to bring your arm across just like that. Now let your arm hang down. That feels supported,
Yeah,
but you can't force it down.
Right.
Okay, so then to take it off, you're going to raise your arm up and just pull it out like this.
Okay.
Okay? All right, so you should be good to go.
All right.
Hope you're able to get home safely.
Thank you.
You want to leave this on for 48 hours as well as the brace. Obviously, you can take them off to sleep and shower, but other than that, you should have them on.
All right.
Okay? The wrap can come off as soon as you get home.
Gotcha.
Okay? Well, thank you so much, James. I appreciate you. I hope you feel better.
All right. Thank you.
Have a good day.
You too.
All right. Hi, James.
Hello.
Welcome to the clinic.
Thank you so much.
How are you feeling today?
I'm okay. I've had better days.
Okay. So it looks like you're in for an ENT exam today.
That's correct.
All right. Well, my name is Dr. Perez.
Okay.
It's nice to meet you. I will be your ENT specialist today.
All right.
Can you tell me a little bit about what brings you in?
Yes. I'm just having some issues. Having some runny nose issues, some runny eye issues, scratchy throat every now and then. I don't think it's quite an ear ache, but I do have a slight pain with my ears, like a aching sort of pain. Just in this whole general region, it's just, I don't know what's going on.
Sounds like you're maybe having some issues with either an allergy or seasonal allergies. Which ear are you having the pain in?
This ear, my right ear.
Okay. Right ear. All right. Let me just go over a couple of things with you. I will be taking some notes as we kind of go on.
Okay.
So I'm hoping it's not something more serious like an allergic reaction, but we'll have to do some tests to kind of determine a little bit more about what's going on and help me pinpoint a diagnosis.
Okay.
Can you tell me how long you've been experiencing these symptoms? Like a couple days, a couple weeks?
It's been about a week now.
About a week?
About 6 or 7 days.
Okay. And has it progressively gotten worse over the course of those days, or is it about the same?
It's gotten worse.
Gotten worse. Okay.
Yeah.
Got it. And are you in pain currently?
I'm not in pain, just a dull ear ache.
Dull, okay.
It doesn't really hurt, but I can tell that it's there, if that makes any sense.
So it's just kind of dull and achy.
Yeah.
Are you able to grade that on a scale? Like if you were to give me a 1 to 10?
A 2.
2.
Yeah.
Okay. And is your pain localized just to that area, or is it kind of...
Yeah, it's localized
sometimes ear pain can radiate
to my ear a little bit, kind of to my neck, kind of just in
down.
this.
Okay.
Yeah.
Got it. Okay, any sharp stabbing pain?
No.
Okay, good. And have you been experiencing any fevers or localized heat kind of in your ear that you've noticed, or just a general fever?
It is a little bit warm around
warm?
the area, yeah. Just in the ear area.
Okay. Do you have any known allergies or family history of allergies?
Just a seasonal
Just
allergy.
seasonal, nothing specific, no.
No.
Allergies to medication or anything like that?
No, none.
Okay, no known medical allergies. That's good to know. And have you ever experienced this before? Like, is this something that
No.
kind of comes and goes certain times of the year, or this is like a first time?
This is all brand new.
So you're not typically a person who experiences seasonal allergies as far as you're aware?
No.
Okay. Are you new to the area by chance?
No, I'm not.
Okay. Any issues with any kind of chronic infection, such as tonsillitis, strep throat, flu? Do you tend to get sick every year?
No, I don't.
Okay, so pretty healthy in general. Have you ever had strep throat?
I don't think so.
Have you ever had influenza?
Yes, I've had the flu before.
Okay, recently?
No, it's been years.
And are you up to date on your vaccinations?
I am.
Okay. All right. Have you ever been diagnosed with COVID?
I have, yes, one time.
Do you remember when?
It's been about a year now.
Okay. So 1 year since you've had COVID or any COVID symptoms.
That's correct.
Perfect. So we can probably rule that out.
Yeah.
Are you having any symptoms of any respiratory diseases like shortness of breath, asthma,
No.
any wheeziness?
Nope, none
like
of
a
that.
dry cough, nothing like that?
No.
Okay. No rapid breathing?
Nah.
Okay, perfect. Okay, and do you have any suspicions that you might be allergic to anything specific or anything in particular?
Not that I know of. I can't think of anything. I've been thinking about it, trying to figure it out, but
Nothing that you can kind of pinpoint to
No.
think would be causing these problems?
Not
Okay,
at all.
perfect. So I do have kind of a better idea of what I think might be going on.
Okay.
I do want to do a brief physical portion.
Okay.
You did say you were having some ear pain,
Yes.
so I definitely want to have a look at that.
Okay.
And just kind of in general, I would like to have a look at your eyes, your nose, the back of your throat, make sure
Okay.
there's no kind of obvious agitation that might be causing this.
Okay.
I'm leaning towards seasonal allergies,
Right.
even though that's not something that you have in your history.
Right.
It could be something new. We have a lot of pollen this year,
Yes.
so definitely something to look into. All right, so let me go ahead and have a look. I'm gonna get on a pair of gloves.
Okay.
So I will be touching your face. Obviously, I'll be careful with that
Okay.
right ear. Just move my table here. Okay. So I'm going to start off by having a look in your eyes. Do you
Okay.
mind removing your glasses?
Sure.
Perfect. Okay. All right, so I'm just going to have a look at your face kind of as a whole. I'm looking for any noticeable swelling in your maxillary sinus areas, which I'm not seeing right now. You did say you were having some issues with nasal drip and kind of eye watering, which I'm not noticing just yet. Is that something you had like this morning or at some point today?
Yeah, this morning for sure.
Okay. Right now it looks okay. I'm just going to lift up your eyelid. I'm going to put just a little bit of pressure on your tear ducts. Let me know if this is uncomfortable or if you feel
Okay.
like a fullness. Does that feel okay?
Yeah, it's just almost making this eye want to tear a little
Okay,
bit.
so putting pressure there is,
Yes.
so I'm going to do that down your kind of
Okay.
outward nasal passages here. Does this feel uncomfortable or do you feel like a fullness there, like your sinuses are maybe
Yeah, on the right side.
on the right side?
Yeah.
Okay, so more so here
Yes.
than here.
Yes. Absolutely.
And if we go out a little bit,
Nothing.
not as much.
No.
Okay. All right, can I have you just turn your head for me? Is that uncomfortable or painful?
No, it's not.
If we do down,
Well, slightly, yeah.
a little bit?
I can feel it. It's not too painful, but
Okay.
I notice it.
And if I put a little bit of pressure here, a little bit uncomfortable there. Okay. And you said that pain was radiating slightly down your neck.
That's correct.
Do you notice maybe some slight swelling in the lymph node here?
Yep.
Is that painful?
Slightly.
A little uncomfortable. So the good news is I'm not noticing any signs of abnormal discharge or secretions. It doesn't look like you have an overload of earwax. You turn your head in the opposite direction for just a second. No pain or discomfort with this side, correct?
No, none at all.
All of this feels okay. And nothing here.
No.
Okay. All right, so I'm not suspecting any kind of ear infection or damage to your eardrum.
Okay.
I do want to do a brief hearing test,
Okay.
just to rule out any hearing loss.
Okay.
But I'm guessing this is probably due to just sinus overload that's putting pressure on your ear.
Right.
So I am going to test your eardrum
Okay.
by putting a slight puff of air inside your ear.
Okay.
If this causes you any pain, let me know. If it does, we might be worried about something more serious happening with your tympanic membrane, okay? So I'll have you turn your head for me. Go ahead and close your eyes. I want you to say yes when you feel this and tell me if it's painful.
Okay. Yes. Yes, it's not painful though.
A little more in the ear now.
A little bit more painful, yeah. Yes, I hear it. It's a little bit more painful.
A little bit more painful.
Yeah.
Okay. Let's go ahead and do the other side. I'm just going to do a couple here.
Yes, I hear it.
Any
I hear it.
pain or discomfort there?
No, there's no pain.
Okay. I'm going to have you open your eyes wide for me.
Okay.
Okay, normal reaction there. I was looking for that kind of natural reaction to blink, and you did blink, so that's great. Okay, so let me just do one more ocular motor test. My headlight will cooperate here. Okay, so I'm gonna have you look straight ahead. I want you to keep your head fixated
Okay.
and follow the light with your eyes. Any pain or discomfort, double vision, blurry vision?
No.
Okay, I do notice some slight watering on the right side.
Right.
Okay. And the last thing I want to do is test your reflex in your eye. So I'm going to be putting a cotton bud at the corner of the outside of your eye,
Okay.
and it should make you blink.
Okay.
So open your eyes for me. Very good. I know it's uncomfortable. I apologize, but it is. Okay, so definitely getting a little bit of an overreaction on this side.
Right.
Are you experiencing some sensitivity there now?
I am.
Probably from the light.
Yeah.
Okay. All right, so I'm gonna have a look at your nose. If I could have you tilt your head back for me. Just looking for any visible occlusions. Not seeing anything just yet. Don't appear to have a runny nose at this time. I'm gonna occlude one side here. Take a breath in for me. And the other side. Both sides, breathe through your mouth. Okay, so no kind of notable occlusions at this time. It sounds like your nasal patency is equal and bilateral on both sides. I'm going to do a brief smell test.
Okay.
So I'll have you close your eyes. I'm going to occlude one nair and want you to tell me what you smell on the other side, okay?
Lemon.
Very good. That's lemongrass. I'll do the other side. So it's a little harder.
Like herbal tea.
It's tea tree. Very good. Very good. That one is a little more difficult, so it's good that you were able to tell what it was. Okay, let's go ahead and move on to a brief oral exam. I'm just going to get my tongue depressor here. So if I can have you stick out your tongue and say, ah. Good. Look at the back of your throat. You look at the hard palate. Can I have you lift your tongue up to the top of your mouth, just looking at the soft palate? Okay, not noticing any abnormalities. Is that uncomfortable? Okay, so this is going to be slightly uncomfortable. I do need to test your gag reflex, so I want you to just relax. Go ahead and close your eyes and stick your tongue out for me. Okay, thank you. I'm sorry. You did very well with that. Tonsils look normal. I didn't notice any swelling or any signs of tonsil stones.
Okay.
You don't have any discoloration or nodules at the back of your throat, so I definitely don't think you have strep or anything like that. How many times a day would you say you brush your teeth?
Twice a day.
And floss?
Once a day. Maybe once every other day. I need to get a little better at that.
Okay. Do you use mouthwash?
Yes.
Daily?
Yes.
Perfect. Okay. So next thing I want to do is test your facial strength. Make sure we're not having any loss of the facial muscles in your face.
Excuse me.
No problem. You ready?
Mm-hmm.
Okay. So I'm going to have you puff out your cheeks. Don't let me push them in. Okay. Do that one more time. Okay. Can I have you move your tongue to one side? Don't let me push it in. And the other side. Very good. Now kind of brown your lips. Very good. Okay. So no issues with that. And the last thing I want to do for your oral exam is what's called a smile test. So first I'll have you smile with no teeth. Just checking for any asymmetry. And smile with top teeth only.
Top teeth only?
Top teeth only. I know it feels a little silly.
It does.
Very
I
good.
don't know which way is top teeth.
Okay, no, you can do full teeth smile. Very good. Okay, no issues with that. I apologize. I know it feels a little silly, but you did very good.
Thank you.
Essentially, that tests your facial muscles and the jawline. Make sure there's no discrepancies with that, but you did very well. Okay, so let's go ahead and roll that out. Very good. And the last thing I want to do for your ENT exam, besides testing your sensation, is I'm going to do a very brief hearing test.
Okay.
So I will test the left side just to make sure you can hear. So close your eyes for me. You hear that?
Yes.
Does it sound farther away now?
Yes, it does.
Tell me when it gets closer.
It's closer.
Okay, so no discrepancies on your left. So we'll do a little more of an in-depth test on your right.
Okay.
Can you hear that?
Yes, I can.
Is that uncomfortable at all?
Slightly,
Slightly
yes.
uncomfortable. Okay, I'm going to move it farther away. Tell me when you hear it up closer.
Closer.
Very good. Tell me what sounds closer, 1 or 2?
2.
And now 1 or 2?
1.
Very good. Okay, I'm going to make a sound with my hands. Can you hear that?
Yes.
Okay, tell me when it gets farther away.
It's farther.
And closer.
Closer.
Tell me which is closer, 1 or 2? 1, 2.
1 is closer.
1, 2.
2 is closer.
1, 2.
2 is closer.
Okay. I'm going to occlude this side and whisper something in your ear, and I want you to just tell me what it is.
Okay. Okay. Therapy cat.
Very good. Therapy cat.
Therapy cat.
Okay. So I'm not noticing any issues with your ears or hearing, which is good news. All right, James. So one of the last things we're going to do is test for any issues with ocular occlusion. So this is going to help me determine if the swelling that's in your nasal passageway is occluding your eyes too much.
Okay.
So what I want you to do is hold this up to your eye. It's obviously going to completely occlude one side. Are you able to see my hand here?
Yes.
Tell me how many fingers I'm holding up.
2, 4, 5.
Very good. Go ahead and switch. Can you see my hand?
Yes. 2, 3, 5.
Very good. Okay, so no issues with ocular occlusion, which is great. And the last thing we're going to do is test your facial sensation. And I'm going to do that a couple different ways.
Okay.
So this might be slightly uncomfortable. I'm going to be using a reflex hammer to put pressure on your nasal passageways.
Okay.
So it might feel kind of uncomfortable. If it's painful, let me know, okay?
Sure.
So I'll have you close your eyes. Tell me if this is on the left or the right.
The left. The right. The middle. The right. The left.
Is any of that uncomfortable?
No, it wasn't.
So I want you to open your eyes. Try to keep your eyes open, but don't force yourself not to blink. I'm going to test your ocular reflexes, so I'm going to have you look straight ahead. Very good. Keep looking ahead. Okay. One more time. So mostly normal reaction. I did notice a little bit of an overreaction again on the right side.
Yes.
So now I'm going to test your sense for sharp or dull. So can I have you hold your hand out for me? So this is dull.
Okay.
And this is sharp.
Okay.
Can you tell the distinction there?
Yes, I can.
So go ahead and close your eyes for me. I'm going to do this on your face. I want you to tell me if you feel sharp or dull.
Okay. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay. So we are all done with the sensation portion. You did miss a couple that were right over your maxillary sinus.
I think I realized that after.
Yeah, I think it's probably due just to, you have a little bit of swelling going on, so that sinus pressure is kind of occluding your neurological senses, but that's okay. Okay, let me just take a couple of notes here.
Okay.
Okay. All right, James, the last thing we're going to do before we begin your allergy exam is I want you to take a drink of this water.
Okay.
We're going to do it in 2 sips, so drink half and then hold it. Very good. Okay, so no issues with that. So let's go ahead and move on to the allergy test portion of the exam.
Okay.
I'm going to be placing this on your lap, if that's okay, just to keep your clothes free of any debris.
Okay.
And whatever way is comfortable for you to rest your arm.
Okay.
Is that okay?
Yeah.
Okay. So I'll test this area if that's fine with you.
Yep.
And I'm going to begin by just cleansing the area. So I have some gauze here. I'm going to be spraying just a little bit of sterile water.
Okay.
Okay, and then I have just a Castile soap that I'll be using to cleanse the area. So I'm going to use just a little bit of this. Very good. Okay. I apologize, it's a little cold.
That's fine.
I'm going to spray one more time.
Okay.
Okay, so we'll let that air dry for just a second. And while that dries, I'll go over the allergy test with you. So I have a series of allergens here, and I will be applying them with a cotton tip applicator. Essentially, we're testing for seasonal allergies. I don't think you have any specific allergens that we need to be looking for. You have cats, obviously, so I'm not worried about that being an onset allergen. I do think this is probably more so related to the increase in pollen that we've seen this year.
Yeah.
We do have a couple foreign plants that have been brought over with the on-rise of COVID and shipping manufacturers and stuff. Unfortunately, we're getting some foreign pollen substances brought over. So a lot of people have been having issues with that because you're being susceptible to plants that you've never experienced before. Right. So they're causing allergies in people my patients who never usually have seasonal allergies. Yeah. So I know it's unfortunate, but I'm guessing that's probably what's going on.
Okay.
So it does look like the area has dried. So I will go ahead and begin applying the allergens, and nothing too specific. I'm just going to be applying them in a grid kind of visually from top to bottom. So I will start here. And hopefully we'll get a reaction so we can kind of tell a little bit better what's going on. Very common allergens in here, but there are also a couple that are more foreign. So I do have things like wheatgrass. There are a couple different types of weeds. There's a tree native to the area that a lot of people tend to be allergic to, so we're also testing for that.
Okay.
Starting on our second grid here. These last three are the foreign substance allergens.
Okay.
So these would be the most likely to react positively.
Okay.
Simply because you haven't come in contact with them before. Coming up on our last one. Okay. So we are going to let these sit for about 20 minutes.
Okay.
Whichever way is comfortable, as long as you don't turn your arm in a way that would
Gotcha.
affect the test.
Okay.
I will leave you for a couple minutes and I'll come back and check to see how we're doing, okay?
Okay,
All
cool.
right, I'll see you soon.
All right.
All right, James, let's go ahead and have a look. I am seeing a couple positive reactions, and
Yeah.
as suspected, it's on the foreign allergy chart. So I'm just gonna have a look with my pen light here. Are you experiencing any itchiness?
I don't think so.
Okay. So we do have a couple mild visible reactions here. So as you can see, there are no raised areas on our first grid. All of that looks normal, but we do have just some slight swelling and agitation here.
Right.
Okay. So as suspected, you are experiencing some seasonal allergies here to those foreign substances. Fortunately, the reactions are not severe enough that I'm suspecting you're, at risk for anything like anaphylaxis or anything more serious. But
Good.
unfortunately, with the rise in these shipments, these plants are likely to continue coming over. So you will be in contact with them more frequently. Do you ever take anything like Claritin or Allegra, Benadryl if it's more severe?
Every now and then, yeah.
Every now and then. Okay. Let's start a measure of these more positive reactions. They are very small and not what I would consider super significant. Okay. So definitely recommend taking kind of a daily antihistamine.
Okay.
I usually recommend Claritin to my patients because it's the most gentle but seems to be pretty effective.
Okay.
If you're experiencing these at night, most people tend to kind of wake up with them in the morning.
Yeah.
It depends on what time of day you've been outside, but if this is something you're experiencing at night, I would recommend taking something like a Benadryl because it also will help you sleep and hopefully wake up a little more clear.
Okay.
If it's not super severe, you could take a Claritin and hopefully that'll get you through the day. They do have Claritin 24 hours.
Yep.
I don't recommend taking it every day if you don't need it.
Yeah.
The thing about allergy medication is people tend to become immune to it. So if you take Claritin every day for 30, 60, 90 days, you probably will have to switch to something else, like switch to an Allegra, and then maybe switch back to a Claritin. A lot of people have to go back and forth because your immune system starts to build up a tolerance to the medication. So at this point, if you're feeling uncomfortable enough on a daily basis, you can go ahead and take something like that if you feel like it's necessary.
Okay.
The good news is I don't think you're having like I said, any kind of ear infection. I don't think you have any nasal polyps or anything like that. Obviously, the discomfort in your eyes is just due to the sinus buildup. So, some at-home treatments you could do for that is taking a hot shower, sitting in the bathroom. If you have access to like a steam room at your gym or something, that might be a good idea just to help get rid of some of that sinus pressure.
That makes sense.
You're not contagious or anything like that, so you don't have to worry about getting other people sick. This isn't like a virus or a bacterial infection or anything like that. It is just seasonal allergies, which is, good news.
Cool.
You might want to look into some eye drops. So they have dryness drops, moisturizing drops. I know you said you kind of tend to wake up with more dry eyes.
Yeah, absolutely.
So you might want to use some moisturizing drops in the morning. But if your eyes are overly watery, especially that right side, I was noticing some kind of tearing in the right side. You might want to use some drops that will help with that at nighttime, okay?
Sure.
All right. So make sure you're staying hydrated. That's going to be a big thing.
Okay.
Let me go ahead and clean this area for you. And I'm just going to apply a little bit of a honey gel. It's just a therapeutic gel that will help get rid of some of that outward swelling. So you're not going home feeling uncomfortable because I don't want that to irritate you for the rest of the day. Do you have any questions for me?
No, I don't think so. That was very thorough. Thank you.
Okay, perfect. Hopefully your symptoms won't get any worse. If they do and you start to feel like you're not getting any better or the Claritin's not helping, especially if that ear gets worse or you start experiencing any inner ear pain or any type of abnormal discharge or change in your earwax, I definitely want you to come back because that might mean that we're looking at something more severe with that right ear, okay? But other than that, I honestly think you'll be okay with some just kind of day-to-day allergy medication. So this is just therapeutic honey gel, and essentially it'll just help take away some of the inflammation on these positive reactions that we got. So I'll just go ahead and rub that on for you. It is going to feel a little bit sticky.
Yeah.
It will help with any inflammation. This is also really good for bee stings, mosquito bites, anything like that. Okay, so that should provide you with some relief, at least topically.
Yeah.
If you go home and you feel like your symptoms have worsened, I would probably just take a Benadryl and you should be okay.
Okay.
Just making sure we really got it in. Okay. All right, James. Well, you are welcome to wash your hands on the way out if you'd like.
Okay.
And I can write you a prescription for the Claritin if you'd like, but it's an over-the-counter, so you're able to just pick it up at your local pharmacy.
Okay.
Okay?
Yep.
So like I said, if your symptoms worsen, please come back and we'll have another look. But other than that, I think you're going to be okay.
All right, cool.
All right. Thank you so much. Have a good day.
You're welcome. Thank you.
All right, Mr. Monroe, thank you for coming into the office today.
Sure.
So we are doing a cognitive assessment and cranial nerve exam, correct?
That's correct.
Can you tell me a little bit about what brings you in today?
Sure. About 2 years ago, I had a concussion playing football. So they asked me to come in every 6 months to a year for an evaluation.
Okay.
So it's time for my evaluation.
Okay, so we're just here kind of doing an annual checkup to make sure that everything is still okay.
That's correct.
Okay. And I did see that you have a history of post-concussion syndrome,
Yes.
kind of at baseline, 2 years secondary to your concussion.
Yes, unfortunately.
Okay. All right, well, I'm just going to be taking some notes as we kind of go along today.
Okay.
I do have you here, as we stated, for a cognitive function test, essentially testing for any neurological deficits, any kind of decline since your last exam with your previous PCP.
Right.
So I didn't see anything significant in those notes, aside from the post-concussion syndrome, which we will address today.
Okay.
Unfortunately, it does tend to have long-term effects in a lot of people.
Right.
Okay. And you said you were playing football. Is that just recreational?
Semi-pro football.
Semi-pro. Okay, wow. All right, so let me just note that down here. Okay. Just to give you a little bit more of a description of what we're going to be doing today. Basically, we call this an annual cognitive screening. We're ruling out any complications secondary to your post-concussive syndrome. I'm testing several things today as far as your orientation and mentation, your current mental status, cognition, your mental and societal awareness, and that kind of thing.
Okay.
Obviously, the goal today is to clear you of any further neurological impairments. So
Right.
I know all of that sounds kind of convoluted. We'll go through it step by step. It is a pretty extensive test, but
Okay.
it's nothing too complicated. Okay.
All right.
So to start, I just really want to obtain your kind of baseline mental status and orientation. Essentially what that means is how alert you are, what we would say with it you are, if you're
Okay.
having any kind of intellectual impairments, that kind of thing. So I'm going to ask you a few questions.
Okay.
Can you tell me your full name?
Sure. James Monroe.
Perfect. And what is your date of birth?
Date of birth is 3/15/1989.
Perfect. Alrighty, can you tell me how old you are?
Sure. 34 years old.
Perfect. Do you happen to know today's date?
Yes. Today is July 12th, 2023.
Very good. And what day of the week is it?
It is Friday.
Okay, can you tell me what state we're currently in?
Yep, we are in Washington State.
Very good. And would you say we're outside or inside?
We're inside.
Perfect. And can you tell me what kind of building we're in right now?
A brick building, a medical building.
Very good. Perfect. So how did you get here today as far as transportation?
I drove.
Very good. And lastly, can you tell me why you're here?
I'm here for my annual exam post-concussion.
Very good. So based on these questions, I would rate you a NO times 4. Essentially, that means you are alert and oriented to person, place, time, and situation. So you know who you are, why you're here, that kind of thing.
All
Okay.
right.
So let's go ahead and move on to series 2 of the test, which is our cognitive screening. So for this part of the test, I'm going to be asking you a series of questions, having you repeat some things. I might have you write something down, and we're just kind of testing your mental and societal awareness as well as your memory. Okay.
All right.
So I'm going to have you repeat a couple things for me. Can you repeat the following words? Crossover, calendar, community, calming.
Crossover, calendar, community, calming.
Very good. And can I have you repeat these numbers in the exact order that I state them to you?
Okay.
57, 63, 91, 86, 40.
57, 63, 91, 83, 40.
Very close. Let's do that one more time.
Mhm.
57, 63, 91, 86, 40.
57, 63, 91, something, and 40.
Okay. So unfortunately you did get that one incorrect, but it is a little more difficult. So that number that you missed both times was 86. The first time you said 83, which was very close, and the second time you declined to answer, which is okay.
Okay.
So this one's going to be similar, but a little more difficult. So this time I want you to repeat the words in a backwards order from which I state them to you, okay? So a little more difficult here. So 91, 86, 63, 40, 57.
57, 40, 86, 90,
Okay,
53.
very close. Slightly out of order. We'll try that one more time. It's okay if you get it incorrectly. It is a little difficult.
All right.
91, 86, 63, 40, 57.
57, 40, 93, 86, 51.
Okay. Very close, but again, incorrect. That's okay. You have trouble with that third number there. That's all right. Let's go ahead and move on. Okay. So I'm going to have you list the next 4 letters that come after D. You're welcome to say them out loud or recite them, however.
A, B, C, D, E, F, G, H.
Very good. And I'm going to have you solve this series of math problems verbally if you can.
Mm-hmm.
7 plus 5.
7 plus 5 is 12.
12 minus 4.
12 minus 4 is 8.
8 plus 9.
8 plus 9 is 17.
Very good. Okay, now I'm going to have you solve this series of math problems on paper. So I have 3 different math problems here. I'll hand this to you and have you work them out.
Sure.
Try not to look at the bottom of the paper.
Sure.
I know that's a little difficult, but
That's fine.
you're welcome to use any area of the paper as scratch paper if need be. Okay, so we have 16 minus 9.
Oh, 16 minus 9? I think I saw plus.
I think you did. That's okay.
Okay.
So 16 minus 9. I do have to count that as incorrect. You did add it.
I understand.
12 times 2 is 24. 57 plus 94 is 151. So very good. So that first one obviously was a miscommunication. That's okay.
It's all right.
So in the space here, I want you to draw any shape. So I'll hold the clipboard for you. If you could draw a shape for me there. And another different shape. And one more different from the first two. Okay, and can you tell me what shape that is?
A triangle.
And this?
A square.
And this.
An octagon.
Very good. Thank you.
Sure.
Okay, so let's move on. I am going to have you count backwards from 30 to 20, skipping the number 24.
All right.
So backwards from 30 down to 20, skip 24.
All right. 30, 29, 28, 27, 26, 25, 23, 22, 21, 20.
Very good. Now I want you to tap your finger on the table anytime you hear me say the letter C.
Okay.
So I'm going to say a series of letters. Anytime you hear the letter C, I want you to tap your finger, okay?
Okay.
2, C, F, T, B, D, C, E, G, C, P, V, T, C. Very good. Just 1 second. Okay. So you did very good with all portions of the test. I am going to bring out a chart here.
Okay.
And this is a stroke evaluation chart. Obviously you didn't have a stroke, but we use this to test other kinds of neurological dysfunction.
All right.
So for this side of the test, I want you to point to the object you would use to open the door. And can you tell me what that is?
That's a key.
Very good. Can you point to the object you would wear on your body?
Sure. These gloves.
Very good. Can you point to the object you think would be the largest in scale in real life?
It's hard to say, either the cactus or the hammock.
Very good. Okay. So I would say the hammock because it is attached to the tree, but I could see why you would say the cactus, so I'll count that as a correct answer.
Okay.
And can you tell me how many pictures you see on this page?
Sure. 1, 2, 3, 4, 5, 6.
Very good. Okay, and can you tell me on this side how many beings are in this picture? I will let you interpret what the word being means.
All right. I see 3 beings. I see 2 children and an adult.
Very good. And which person in this situation is in the most imminent danger given the picture?
The young man that's on the crooked stool up in the air.
Can you tell me why?
He's about to fall at any moment.
Very good. Okay, can you tell me if there's anything about this scenario that's unusual or looks kind of abnormal?
Oh yeah, the adult is washing dishes, but the sink is overrun with water.
Very
So she's not paying attention to that.
Very
Or her
good.
children, if they're her children.
One second. Okay. Can I have you read these words aloud for me, please?
Sure. Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Very good. Okay, so can you tell me which word or words on this chart can be read backwards that would still make another word?
Sure. Tip top can also be pot, pit.
Very good. Okay. And on this side, can you point to a verb?
Yes, I can speak.
Okay.
I'll point to it, I'm sorry.
That's okay.
Speak.
Can you point to a noun?
Yes. Table.
And a time of day?
night.
Very good. Okay. So let me just flip over to our last page here. All right, Mr. Monroe, so the cognitive portion of our exam is complete and you did very well. There were 3 answers that you got incorrect, but you still have a passing score. So as far as we are concerned, you are cleared cognitively. We do need to go ahead and start with your cranial nerve exam, which, like I said earlier, is going to just further test for any of those neurological deficiencies, specifically any signs of muscle weakness, sensation loss, anything that would indicate your cranial nerves are damaged permanently, okay? So let me just make a quick note here. So also be checking for any signs of cerebral edema, any signs of cervical stenosis, essentially checking your eyes, nose, mouth, ears, facial expression, shoulder strength, that kind of thing, okay?
All right.
I do just have a couple of questions here for you, just as far as your health history. So have you been experiencing any numbness, tingling in any of your extremities or your face?
No, I haven't.
Okay. No signs of muscle atrophy or muscular atrophy, which would be like muscle wasting, weakness in your muscles that you've noticed over time, lack of strength?
No, none of that.
Okay. No issues with loss of balance or coordination? Have you been falling more frequently?
No, I
Have
haven't.
you fallen since the last
No,
2 years ago?
I
No?
haven't.
Okay. And no symptoms of a CVA, which would be any interruption of blood flow to the brain. Do you tend to feel dizzy when you stand up? Do you any stroke-like symptoms at all? No facial drooping that's past, anything like that? No
No.
slurred speech?
Nope.
Nobody's told you that they're noticing any adverse symptoms from you?
Nothing, no.
Okay, well, let's go ahead and move on to our test. Why don't we start with your eyes? So I'm just gonna put a pair of gloves on here. And the first thing I'm gonna test is your pupillary constriction and dilation.
Okay.
So we'll be coming a little closer to you, is that okay?
Sure.
Okay. You're welcome to keep your glasses on. I'm gonna have you look straight at me.
Okay.
And I'm going to be shining a light in either eye. Try not to look at it, just look straight at my face.
Okay.
Just checking for any signs of abnormal pupillary reaction. Checking for equal and bilateral constriction and dilation. Performing what's called a swinging light test, essentially swinging my light back and forth like a pendulum to test your pupillary reaction. So continue looking at the center of my face. I'm going to bring this right to the corner of your eye. Very good. And here. Very good. Okay, so no abnormal response there. Was that painful or uncomfortable at all?
No, it wasn't.
So let's go ahead and move into your ocular motor function. So I'm going to be testing your ability to track the light, to follow it upward, downward, medial, etc. So again, looking straight at my face, I want you to keep your head still, but follow the light with your eyes, okay?
Okay.
Any pain or discomfort with that?
No, it's just very bright,
It's very
but it's
bright,
okay.
I did just change the batteries in my pen light,
Okay.
so it's a little brighter than usual.
They're working well.
Did very well with that.
Thank you.
So let's go ahead and test your visual acuity. Your acuity card, there it is. So I want you to have a look at my chart here. I'm going to hold it about that far away from your face. Can you see that okay?
Yes, I can.
Okay. Can you read that top letter for me?
E.
And the third line down?
F, P, H.
Fifth line down?
D, H, J, B, S.
And what is the lowest line you can read?
L, T, F, P, H, bottom line.
Perfect. Can you tell me what color this is?
That's red.
And I'm going to have you occlude one eye. I have an occluder here actually.
Oh, okay, thank you.
So I'll let you decide. Perfect. Can you read that third line down for me?
F, P, H.
And the very last line you can read.
L, T, F, P, H.
And what color is this?
It's red.
And here?
It's green.
Very good. Switch eyes for me. Can you read the fourth line down?
Yes, I can. O, L, C, F.
And the smallest line you can see.
L, T, F, P, H.
And these two colors?
They're red and green.
Very good. And can you tell me what that first number is?
It's a 2.
And the last number?
It's a 9.
Very good. So, no issues as far as visual acuity. Are your glasses newer? Prescription is up to date?
Yes, it's up to date.
Good. So your optic nerve is intact. Do you want to go ahead and check your blind spot? So I'm going to do a couple different tests for this, okay?
All right.
First, I want you to have a look directly at the center of my face. I'm going to put my fingers at the side here,
Okay.
and I want you to tell me how many fingers I'm holding up on either side, okay?
All right. 2. I'm sorry, I looked.
It's okay. It's hard not to.
2, 3, 5, 5, 5, 4, 3, 2, 1, 5, 2, 1, 5.
Okay. So you did really well with that. You did miss one or two, but that's okay.
I think the light was also still in my eye from the other test.
Not a problem. So let's try something slightly different. So I have a little bit of a different style occluder here. Can I have you hold that up?
Sure.
Are you able to see me through?
Yes, I can.
Okay. Can you tell me how many fingers I'm holding up here?
2.
And here?
Should I move my head or keep my head straight?
Keep your head still if you can.
3.
Very good.
I can't see that one.
Can't see it
Can't
there?
see it,
Okay.
no.
Flip it over for me.
3, 2. I'm sorry, 2.
Good.
Can't see that one. Like 2.
Okay.
1.
Okay. Take the occluder from you. So you do seem to have a little bit of a peripheral defect on that side. Is that something you've heard before?
I don't think so.
So you did miss a couple for both of those tests.
Yeah.
I do consider it passing because you had a passable score, but the next time you see your optometrist, I would maybe mention to him that your peripheral vision on this side is just slightly lagging in comparison to the other side, okay?
Sure. Okay.
Let's go ahead and test you for any color blindness or color deficiency.
Okay.
So I have what's called an Ishihara test book here, and essentially there are a bunch of different colors. So I want you to tell me what number that is.
12.
Very good. So that is a test. You should be able to see that. And here,
8.
and here,
5.
and here,
29.
Here.
74.
and here.
7. 45.
Very good.
2. And no number there.
Okay.
16. And no number there.
Do you see anything here?
Yeah, there's like a pattern, like a snake.
Very good.
35. 96. And another snake-like pattern.
Can you trace it for me?
Sure.
Perfect. Can you tell me what colors you see here?
Yeah, purple, burgundy, maroon,
And at the top?
pink, rose, red,
And
orange,
what color would you say the background is?
black, and gray.
Very good. Okay. So no suspicion of color deficiency. So your abducens and your color blindness are both normal. I'm going to go ahead and check your corneal reflex. And apologize ahead of time, this is a little bit uncomfortable.
All right.
I have a It's essentially a Q-tip here. I'm going to be touching this to the very corner of your eye.
Okay.
I want you to not force your eyes open, but try not to blink until you feel like you have to, okay?
Okay.
Very good. Very good. So let's do that one more time. Okay, so a little oversensitivity on this side.
Okay.
Likely related to that peripheral loss. So
Right.
again, something you should bring up to your optometrist, okay?
Okay.
So we'll do a +1. A +2 would indicate a normal reaction on both sides, but I did see a definite overreaction on this side, okay?
Okay.
So let's go ahead and move on. I do just want to have a look inside your eye.
Okay.
I'm going to be taking my ophthalmoscope here. Essentially, this is just a device that's going to allow me to look inside your eye.
Okay.
So I will have to come fairly close to your face.
Okay.
Can I have you remove your glasses for me?
Sure.
So to start, I'm going to have you look straight ahead.
All right.
Visualizing the different muscles in your eye. Can I have you look over away from me and towards me? Open wide. Good. So, and because this side did have a slight defect, I want to have you lean closer a little
Sure.
here. Look straight ahead. Open wide. Look away from me. And look towards me. Okay, so no notable abnormalities there. Alright, so we are all done with your eyes. Let's go ahead and move on to your olfactory nerve or your sense of smell. Do you notice that you have any issues with your sense of smell?
No, I don't think I do.
No lack of smell or tasting anything,
Nah.
tasting or smelling anything abnormal?
Nah.
Okay, so I'm going to go ahead and occlude one nostril.
Okay.
Take a normal breath for me. Very good, okay. So no notable occlusion. Let's move on to a bit of a smell test. So I want you to close your eyes for me. I'm going to hold something up in front of you, and I want you to tell me what it is if you can.
Orange. Citrus.
Okay, citrus.
Or orange or
Let's
lemon.
try this one.
That one might be more lemon.
Okay, this is the second one again.
It's kind of sour. It's hard to tell.
You want the first one again?
Yes, please.
Okay. This is the first one.
I'm not sure. I want to say citrus, orange, or lemon, but there are different types of citrus.
They are different types of citrus. Very good. So
Okay.
let's try one more. Can I have you occlude a nostril? Doesn't matter which one.
Sure.
Can you tell me what that is?
One more time, please.
You want to try the other side?
Yes. It's very strong. It's almost like a vinegar smell, but I can't quite place it. It's not sage.
Okay.
I'm not sure.
I'm going to have you occlude one nostril.
Okay. I didn't get anything with that one, just a slight burning. Let's try the other one. I smell something, but I can't quite tell what it is.
Okay. So let's try this. Go ahead and occlude a nostril.
Mint.
Mint. Let's try that one more time.
Okay. I really don't know.
Okay. So unfortunately, I do have to put you down as a non-passing score for that.
Okay.
So the first one was orange,
Okay.
which you did note initially with both nostrils open. You said it
Right.
was citrusy, but
Right.
kind of sour.
Yes.
It's actually sweet orange.
Okay.
And then the second one was lemongrass, which
Okay.
again you said you weren't quite sure, but it was citrus.
Yeah.
The third one was actually tea tree.
Okay.
So I'm not sure
I was
where you
getting
got
like
the
a
vinegar from, but it is a
Yeah.
very strong
It
smell.
was just like a spice. I
So
couldn't
now
get.
that you have your eyes open, obviously the test is completed, but I just want to see if you can kind of associate
Yeah.
sweet orange.
Yes. Orange peels. I can smell it now.
Okay. This is lemongrass. So it's kind of an earthy,
Okay.
herbally
Yes.
lemon.
Yes. Okay, that was kind of throwing me off.
Tea tree.
Yeah, it does smell like vinegar a little bit.
Okay. Okay, so I'll go ahead and mark that down.
Okay.
Okay, so let's go ahead and move on to your kind of glossopharyngeal hypoglossal reflexes, essentially testing your throat,
Okay.
mouth and throat. So if I can have you open up for me and say one more time, Can you raise your tongue up to your hard palate? Very good. And then over and over the other side. Good. Okay. And again, I apologize. This is not the most pleasant part of the examination, but I do need to test your uvula or gag reflex. So go ahead and stick your tongue out. Very good. Sorry.
It's okay.
Good job. And I do want to go ahead and do a swallow evaluation. So I'm going to give you this, and I want you to do this in 2 sips. So the first one, go ahead and drink it down. Any issues or abnormalities with that?
No.
Okay. Excuse me while I come around here.
Sure.
So I'm going to have you do that again. Very good. Can you tell me what that tastes like?
Pineapple.
Good. I'm going to come behind you for just a second.
Okay.
Just kind of on the side here. Can you open for me? And close. Open, close, open, close. Very good. Just checking for any signs of TMJ or looking on your jaw.
Okay.
Okay, so all of that was the normal limits. Alright, so let's go ahead and move on to your ear exam. Switching over to my otoscope. So I'm just going to start with having a basic look in both ears.
Okay.
Let me know if this causes you any pain or tenderness if I palpate your ear.
No. No pain. No tenderness.
Visualizing the eardrum. Very good. No excess earwax. Any pain or tenderness on the side?
Nope.
Okay. Eardrum is pearly gray. Okay, very good. Okay, so we're going to be testing your vestibulocochlear nerve, which is essentially your hearing test.
Okay.
So I have a couple different things. Let's start with the most obvious. So I have a tuning fork here. Can you hear that?
Yes, I can.
Okay. So I'm going to put this at the top of your head. You can close your eyes for me. Can you tell me if you hear that equally in both ears?
Yes.
What side do you hear this on?
The right. The left.
Good. You hear this?
Very lowly. Yes.
Hear anything?
Barely. The right.
Very good. Tell me when the sound stops.
It stopped. It stopped.
Very good. Now I'm going to do another version of that, but with something slightly less obvious. So I have a little device here that makes kind of a puff of air sound.
Okay.
I want you to close your eyes and say left or right, depending on where you hear it.
Okay. Right. Left. 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 Front. Top. Right. 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 Left. Right. Right. Middle, top.
Very good. Okay. So let's do one more. This time I'm just going to make a soft sound with my gloves.
Okay.
I'll move it further away and closer to you, and I want you to just say yes if you hear it and on which side.
The right side. The right side. The left side. The left side. Both sides. Both sides. Left side. Left side. Right side. Front, middle, both sides. Both sides. Right side. Right side. Left side.
Very good. Absolutely no issues with your hearing. Some of those were very quiet, and you did hear all of them.
Okay.
So let's move on to your facial nerve, or what's called your trigeminal nerve, and essentially this is going to be testing for any sensation loss in your face.
Okay.
So I have a couple different things that we'll test here. Is it alright if you remove your glasses, just
Sure.
so I have a little larger of an area to test?
Sure.
I have a little cotton wisp. I'm just going to test this on your hand. Can you feel that?
Yes.
So you're going to have your eyes closed and just say yes if and when you feel it.
Okay. Yes. 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 Yes.
Very good. Moving on. This one is going to be a kind of soft or sharp test.
Okay.
So can you tell that this is soft
Mhm.
in comparison to this?
Yes.
Okay. So you'll either feel this, this, doesn't matter. One is soft, one is sharp, okay?
All right. Soft, soft, sharp, 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 soft, soft, sharp, soft, 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 sharp, sharp, soft, soft, sharp.
Very good, James. No issues or discrepancies with your soft or sharp.
Okay.
Let's move on to something that is more specifically sharp. I have what's called a Wartenberg wheel, and it is fairly sharp.
Okay.
I won't be pressing it hard enough to puncture your skin or anything like that, but you
Okay.
should feel a distinct sharpness.
All right.
So this test is a little different. This time I'm going to glide it across different portions of your face.
Mhm.
I want you to tell me if the sharpness decreases at any point, okay?
Okay.
So does it feel the same here and all the way across here
Yes, it does.
and here?
Yes.
Here versus here.
Yes.
Forehead, nose, chin.
Yep. Same. Same.
Any difference on either side? It should feel
No.
equal.
There's no difference.
Okay, very good. So your trigeminal nerve appears to be intact. And I do want to bring that down very briefly to your arms.
Okay.
So using the soft or sharp, I want you to tell me if you feel soft or sharp on either arm, okay?
Okay. Soft, soft, sharp, soft, soft, sharp, soft, soft, sharp, 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 soft, sharp, soft, 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 sharp, 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 soft, soft, sharp, soft, soft, sharp.
Very good. Okay. And then lastly, similar to the last test we did on your face, you can keep your eyes open. Does this feel any different as we progress down your arm?
No, it does not.
Feels the same here, here.
Yep.
Okay. And this also tests your lumbar function, your spine is connected to your arms. I know that sounds odd, but testing your
It feels the same.
arms here, all of that is
Yes.
very good. So let's go ahead and move on to the last part of our examination today, which is testing your accessory nerve or your musculoskeletal movements. So what I'm going to do is I'm going to have you do a couple things against resistance.
Okay.
So can you turn your head into my hand?
Sure.
Don't let me turn it back. Other side. And back. And down. And open. And close. Don't let me open. Can you close your eyes real tight? I'm going to pull these down for just a sec. Can you scrunch your eyebrows? Can you scrunch your nose? Very good. Okay. So I'm going to have you shrug your shoulders. Don't let me push them down. Can you close your arms out like this? Don't let me pull them back. Now push back towards me. Very good. Can you open your hands like this? Don't let me bring your fingers together. Now I'm gonna have you just like this. So kind of crab fingers, there you go. Don't let me move your thumb. Now I want you to squeeze my hand as hard as you can theoretically. Don't, okay, very good, from this side. Okay, very good. Now I want you to bring your arm kind of out. Try not to let me push it down. Now push down against me. And do the other side. Down against me. And don't let me push it up. Can you hold your hand straight out like this? Close your eyes for a second. Very good. Go ahead and open. Okay. Your accessory nerve appears to be intact. No discrepancies there. And I believe that is all I have for you today, James. You passed, essentially. There were a couple things that you missed, but nothing major. I do think the post-concussion syndrome is still here, unfortunately. You are still showing some signs and symptoms. I did notice some very light, like mild light sensitivity in this eye, more so than the other. The peripheral vision was slightly inaccurate, as well as the overcompensation with the corneal reflex test, which is the Q-tip to your eye. You were almost anticipating it with this side, which lets me know that you tend to have some sensitivities more so on this side.
You're right.
Is that something you notice kind of on a day-to-day basis? Okay.
Yeah.
So obviously that was slightly abnormal. As far as your cognitive screening and your neurological assessment, you did miss a couple of the repetition numbers. That's not something that I maybe think is related. It is a difficult test. I don't think it's anything that, you know, is suggestive of any kind of neurological or cognitive deficits as far as I'm concerned with that test. I do, however, want you to at least mention the abnormalities to your optometrist the next time you see them. I will send these over just so they have the notes. They don't always follow up, so if you wanted to reach out and just mention it to them, maybe they could do, you know, an earlier screening for you.
Hopefully, yeah.
Everything else, as far as your cognitive screening, was completely normal. And then as far as your cranial nerve exam and testing the neurological deficiencies, your musculoskeletal strength and all of that was totally intact.
Okay.
So I'm not sensing that you have any what I would consider permanent nerve damage from your concussion, but I do think the post-concussion syndrome diagnosis is still appropriate at this time.
I understand.
So, as your PCP stated before, we would like to have you continue to come in every 6 to 12 months.
Okay.
12 months really, every 6 months unless you're feeling some sort of decline.
Okay.
12 months I think is appropriate given
Yeah.
how you did on this test today, okay?
All right.
So if you'd like to schedule that ahead of time, we can do that for you. If
Okay.
not, you can call in when it's
Yeah.
time for your next
You
appointment.
Go ahead and schedule it.
Okay. So if you want to head to the front desk, the receptionist up there can help you get that scheduled, and we'll give you a reminder card, and then obviously, you know, give us your preference as far as email or whatever the case is, and we can remind you when it's closer to that appointment date, okay?
All right.
Okay. Well, thank you so much. I hope you have a nice day, and I'm not seeing any cause for concern today, okay?
Okay, good.
All right. Thank you. Have a good day.
Thank you.
Soft or sharp? Soft or sharp? Soft or sharp? Soft? Sharp. Baby cat? Soft or sharp? Is it soft or sharp? Soft? Bruce, can I look in your ear? Follow the light, baby cat.